up in.
Well, did you get an
But you got a
invitation?
paper.
I forgot though. You know, a lot of stuff
Uh-huh.
going on.
A likely start. Move to one of these, Mo, just because Felicia, you can pull that out and use this.
Alright.
Just shove that down over in the corner. So Mo, what I need you to do is, I need you to fill this form out.
Alright.
And then when you're done filling this form out, write this number in the top corner, okay?
Blood pressure's still high. Still high. They're gonna try to get it together, you know, but right now.
Yeah, they will.
Okay, so
Keep trying
Felicia has started recording.
Good.
That's good. There you go.
Your little bell.
No, I really shouldn't, but I'm picking things up.
Just minimize this.
Or rope belt. I had to get a new belt. My belt I'm using is a rope belt now, not an actual belt. So that's why. No, it's
Not saying you can get one off Amazon.
Okay.
Not why it's falling off, though.
So we are recording. Thanks for being here today, folks. And I'm gonna kind of go through, first thing we're gonna do is go through this candidate handbook, okay, and talk about the chest certification, what it entails, what the expectations are of a chest certified candidate under the Association for the Healthcare Environment rules and regulations. So first thing I would say is you're gonna spend a good deal of time together in this room, so make sure you're comfortable. Help yourself to water and snacks. If you have to go to the restroom, you know where they are right down the hall, help yourself to the restroom. But there is a lot of material to get through, all right? So we're gonna mush through this stuff. If you have questions, certainly ask questions. And if you don't understand something, we can try to spend as much time as we can going back over it. Understand that as we go through this program, there is a lot of repetition. There's time at the beginning of each new module to review everything we did in the module before. And then as we get to the next day, there's time for review of all the things we did the day before. So there'll be a lot of review throughout this. So that by the time we get to the end, you're gonna be like spouting these answers off like left, right, and center, okay? Feel free to take notes in your book. The participant guide that you were given is yours to keep. I would say on the inside cover or on the first page or something, write your name and your phone number so that if you lose this or misplace it or leave it somewhere, this is your specific book. It's got this barcode here, okay? That is yours, you own it, and you can keep it. You can refer back to it at any time. And you know, now we're in the future. So the candidate handbook, again, this process is put together by the Association for the Healthcare Environment, which is the AHE. The AHE is a division of the American Hospital Association, okay, and it's specifically an industry, basically trade group for environmental services in healthcare, okay? So that's who put this curriculum together. All right, while putting this together, it's very specific to the healthcare industry. While it may be appropriate for other industries, some of the customer service stuff certainly could apply to hotels or other industries, but it's very geared towards healthcare, hospitals, infection prevention. Okay, it's designed to provide everybody with essential information regarding eligibility requirements related to this certification. Okay, and the period of certification is for 3 years, okay? So when we get each of you this initial certification, it's a 3-year certification. At the end of 3 years, you will have to do one of a couple different things to renew it, okay? You either have to retake the test, which I think probably none of you will want to do. I know I wouldn't want to do it. Or you need to provide credentials that show that you had at least 15 hours of continuing education. So from our perspective, every time we have an in-service, you know, about infection control or 7-step cleaning or things within our purview, the work that we do, we count that as training, all right? So what we're planning to do is kind of at the end of the 3 years, tally up all those hours of training for each of you. We'll help you with that. And then I think you'll see that you have plenty, way more than 15 hours of training over the course of 3 years to renew. And then we'll work on getting your application filled out and sent back in to renew your certification. This certification is a mandatory part of the trainer position here at Roswell. It is written into the job description that you need to get and maintain this certification to remain in your status as a trainer at grade 6, okay? But what this is gonna allow you to do is it's gonna make you the expert in your field, you know? You guys are going to be the go-to expert trainers for us. You're gonna know a lot more detail behind the why of what we do. Okay, we can teach anyone 7-step cleaning. We can teach you, basic infection control. Oh, you have to hit high touch surfaces. Well, why? We don't necessarily always get into the nitty gritty details of why we do everything we do. You guys are going to know the why because we're going to review it in this course. Okay, it's a professional membership group of the AHE. I told you that. They have a lot of other tools and things like that. I refer to the AHE quite a bit. I've been a member of that organization for probably over 20 years and received my CHESUP certification, Certified Healthcare Environmental Services Professional, back in, I want to say, 2005. So I've been a credentialed member of this group for a long time. It's something that sets you apart from your peers. It's something that is you can take with you. It's a designation that's recognized across the country. And it's, it's a good thing for you to have on your resume. You can definitely put it on your resume. Once we get done with this, and if they have new name tags available, you can actually have it put on your name tag with the letters CHEST after your name. Like you see some of the nurses with their credentials and designations. This is a recognized credential by the American Hospital Association, and you are allowed to put that after your name on your badge. Okay, core purpose, again, commitment to a pathogen-free healing environment across all settings. And the mission statement of the AHE is to advance members' ability to establish and maintain care environments that are free of environmental surface contamination and that supports safety, service, and efficient and effective operations. There's a committee that oversees this program within the AHE. And I already told you they're affiliated with the American Hospital Association. One thing I would add, though, with regard to this being part now of the grade 6 position, this really represents a commitment by Roswell to kind of create a career ladder within our department. We've talked about this probably in some of our big meetings, but bottom line is a couple of years ago, the only option we had, you came in at a grade 4 ES worker, and then there were some grade 8, senior ES workers, and that was it. And you had nowhere to go, really. This represents Roswell understanding that and knowing that, and us working it took quite a while for us to get a new job description put together for the grade 6 to make it different enough from the grade 4 that it warranted being a different grade. And some of that comes with this qualification and this training. All right, so it's definitely not only putting in the grade 6, which gives you guys all some extra money in your paycheck from the grade 4 level that you were at before, but it also, is a commitment. I mean, it's over $1,000 for Roswell to pay for this designation for you. And then, the ongoing cost of renewing it. So they are, putting money into our program and understanding that this will help us in the long run be even better than we are today. So the goals are to ensure you meet the predetermined criteria necessary for certification, define the knowledge, skills, and experience necessary to serve as an ES technician, utilize established principles of testing and measurement to test the knowledge, skills, and abilities, promote the value of environmental services technicians in delivery of patient care to the public, provide a high-quality certification program for environmental services technicians, and provide leadership and means for the credentialing of environmental services technicians. The credential CHEST stands for Certified Healthcare Environmental Services Technician. I know we're calling you guys trainers because we're using this designation to kind of set you apart as the experts in our field. But the T within the CHEST stands for technician. It's a registered trademark of the Association for the Healthcare Environment. Only those who qualified and have met the standards and testing requirements can claim to be CHEST. The T-CHEST, T-CHEST stands for trainer of the program, basically. So we have three T-CHEST individuals right now, myself, Felicia, and Tracy. When Shayna comes back to us, we will probably look to get her T-CHEST certified so that we have another trainer available for us as well. So individuals who allow their CHEST national certification to expire may not use the CHEST credential, nor may they represent themselves as CHEST certified. Okay, so you do have to keep this thing current. Okay, there's a declaration and statement of non-discrimination. So certainly the AHE doesn't discriminate with respect to age, race, religion, national origin, ethnicity, disability, marital status, sexual orientation, gender, or gender identity. And then here are the qualifications. None of you would be here in this room if we didn't think you would either already meeting or will be meeting these qualifications. So they're offered once you've successfully completed this training program that you're going through, you have to also have a minimum of 6 months of healthcare environmental services cleaning experience in direct patient care in an acute care or continuing care facility, meaning like a nursing home or long-term care, or a minimum of 1 year experience in a healthcare environmental services without direct patient care. So you could be like, someone who does linen and doesn't really have direct patient care, but they've been doing it for over a year. And you must be able to read and write in English. Okay, the CHESS curriculum is written at or above the junior high reading level, but is suitable for employees with additional education. So again, I know we have some folks who English is not their first language. We had a couple in our first session, and we were able to get them through this test just fine. All right, so if you're worried about that, if English is not your first language, don't worry about that, because we will make sure that you get the resources you need and help you understand maybe words that don't make sense, or if they're asking questions in a way that doesn't flow for you, we can certainly, explain to you what the question means. We can't give you the answer, but we can explain maybe in a way that makes more sense. This is what the question is asking, okay? Application process. Okay, so those wishing to enroll, you already contacted your supervisor, so that's done. I already told you who the TCHESS trainers are. And it's comprised of 24 hours of classroom instruction. Okay, the content covered in these workshops is based on 7 domains, which are shown below. Okay, so the 7 domains included in this training are infection prevention, cleaning and disinfection, communication, safety, waste handling, linen handling, and floor care. Okay, each domain is covered in a series of 10 modules, which are built around a typical day in the life of an ES technician. So the stuff that we're going to cover are things that you've heard before, okay? This is not like some new, voodoo that we're going to teach you that's different than anything you've been doing every day. A lot of this stuff, when we explain it to you or review the information with you, you're going to go, oh yeah, we do that. I do that all the time. There is going to be other stuff where we review and read it and you say, well, that's not how we do it. Because there are some Roswell specific things that we do. And in most cases, when we get to those points within this training, you're going to be like, yeah, I get why they say there's an industry standard, but because Roswell is a specialized institution specifically for cancer care, we may have a couple different things that we do that might not be exactly what the national standards are. For the most part, what we're going to learn in here is going to sound very familiar to you. And you'll have questions about it, certainly, but it's not going to be like something out of left field that you have no idea what you're doing. So I don't want you to freak out and think, well, I never really did linen, so I'm not going to know anything about that. You're going to be just fine. Okay, so the modules, the first one and probably the longest one to get through is infection prevention and control. Assignments with supervisor and other staff, cart setups and handling chemicals. Occupied patient room number 1, unoccupied discharge or transfer room, isolation room, occupied patient room number 2, common areas, specialty areas, uncommon situations, and there's a wrap up and review and some additional practice. Okay, so there's pretty distinct learning objectives in each module. And again, we can do it over 3 consecutive days. We chose to do it over 4 days just to kind of make it not so, 8 hours a day for 3 days is a long time to sit in a room. So we're doing it 6 hours over 4 days. But as long as we get you the 24 hours of training, that qualifies you to take the test, okay? So then it gives you kind of the breakdown on the next on page 4, gives you the breakdown of kind of each area. The exam itself is 50 multiple choice questions, okay, covering the 7 domains. Each one has a set of associated tasks. And number of questions per domain is equivalent to the percentage content of each one. So because infection control is a higher percentage, 20%, it's going to have more questions than say floor care, which is only 5%, okay? So it's structured so that 38% of the questions pertain to knowledge, 38% pertain to comprehension, and 24% are application based. Okay, and then it goes down to really break down each of the areas within the different categories for the tests. Okay, the procedure is it's online only. It's administered by a TCHESS. at our own facility, so you don't have to go anywhere for it. We'll have it right here at Roswell. Once it's completed, we will notify you, once the training is completed, I will notify the AHE that you're ready to sit for the exam. And then they'll send us a list of codes to log into the exam, okay? On the day of testing, you show up the assigned time and location. You log into a computer using the unique code that they send you, and then we'll proctor the exam. You get 2 hours to complete the exam, which a couple people pushed it pretty close to the 2 hours, but most people finished relatively quicker than that. Scoring, okay, is designed to assess knowledge required for essential environmental services tasks. You must receive a passing score to pass the test. If you don't pass it on the first time, you can take it again, all right? Let's see, how chest examination passing score is set, okay. So this is a little bit of statistics for you. It's not necessarily something you need to know or remember or understand, but the methodology used to set the passing score is the Angoff method, in which content experts estimate the passing probability of each question. These ratings are averaged to determine the preliminary minimum passing score. Number of correctly answered questions required to pass the examination. This method takes into account the difficulty of the chest examination. The preliminary minimum passing score is validated by the test performance of the candidates. So again, they use kind of a statistical method to equate it, but I want to say we had some question on that last time, because one thing we saw said the passing score was 72 and something else we saw said it was 75. So I'll qualify what the test they're giving now and what the passing score is. I'll find that out. But you know, you guys are going to ace this test, so I'm not worried about you being around that 70 mark. So once you passed it, you generally 5 or 6 weeks after you pass it, you'll get mailed a certificate, which verifies, you know, that you passed it, a PIN, a score report, and information about renewal requirements. The name on the certificate will be the same as what you wrote down on that form that you're going to give me at in a minute or two.
Mm-hmm.
And again, AHE reserves the right to publicly recognize you. Basically, they post your name on their website as a chest certified individual, but they never report your score. Upon completion of the test, you will know if you passed or failed, but you won't be able to like see which ones you got right or wrong, okay?
Mm-hmm.
All right, and then finally, this talks about what happens if you fail it. You may retake the test up to 3 times. And if you fail it 3 times, they suggest that you retake the training. Because obviously after the 3rd time, you're probably not getting it. Scores are issued by AHE, examination score. So the scores themselves are confidential. This is not something they share with anybody but the individual who took the test. So you don't, you know, if you passed, Sharita, you passed, and Kapil, you passed, that's all you know is each other passed. Kapil doesn't know what Sharita scored and vice versa. I mentioned renewal already. You have to either retake the test or have 5 hours of continuing education credits per year for a total of 15. Okay, test security, that's really up to the chest, the T-chest people. We do keep this very tight. We spread you out. We make sure you can't cheat. We make sure you can't read each other's answers. We don't read the answers to you. You need to come up with them on your own. So know that, you know, copying, possession of the test beforehand and that stuff is prohibited. And then finally, the professional standards of conduct. Certificant who is awarded certification by the AHE agrees to conduct himself or herself in an ethical and professional manner. By accepting certification, you agree to maintain competence, demonstrate work behavior that exemplifies ability to perform safely, competently, and with good judgment, conduct technician activities with honesty and integrity, avoid discriminating against any individual based on age, gender, race, color, religion, national origin, disability, or marital status. Abide by rules and regulations governing programs conducted by the AHE, not misrepresent the credential, and to adhere to the guidelines for use of the certificate marks as posted on the AHE website. So again, violation of professional standards of conduct could result in them revoking your certification. okay? Any questions on that? I know it's a lot, you will get to keep this, you can re-review it, but at this point, could you please make sure you sign and print and date the bottom? And if you've written your number of your booklet at the top right corner of this certificate, then pass them to me, please. Yeah, just write this number on top of it. Thank you very much. All I need is the back page. I'm sorry. Yeah, all I need is this. You keep the booklet.
Okay.
Thank you. So as we get closer to the end of the week, I'll get these entered in. They send me like a spreadsheet and I get them entered in. And then once we complete it, that's what they use to send the test codes out. Okay, so that's the business side of things. Now we're gonna jump into the actual curriculum. So Felicia and I are gonna kind of tag team this a little bit. There's things I'll work on, there's things she'll work on. We'll probably today get through 2 of the modules. Okay, so the first module is really kind of jumping into, like, they have a little brief introduction. Then there's infection prevention and control. If you look at page 1.4, or yours is different.
1.5.
1.5. Okay, so infection prevention and control is pretty much the kickoff module. That's probably the longest module. It runs about 4 hours. And then module 2 is assignments with supervisor and other staff. That's just under 2 hours. So we'll definitely get through those 2 today. We may get into module 3, or we may just push that to tomorrow. Tomorrow, my expectation is probably get through module 3, 4, and 5, which is cart setup and handling chemicals, occupied patient room 1, and discharge or transfer room. Then on Wednesday, get through 6, 7, and 8, which is isolation room, occupied patient room number 2, and common areas. And then finally on Thursday, get through 9, 10, and then there's a practice. There's like basically a pop-up practice, a game essentially that we play for the rest of it. Yep, wrap up review and then a pop-up practice. All right, any questions so far? Any worries, concerns, things that are freaking you out or what that you're afraid of? Okay, again, this is information that is stuff you do based on things you do every single day, okay? None of this should be like foreign or really out of the blue for you. Some of the things you might scratch your head and say, oh man, we don't really do it like that, or I never learned it that way. But it should ring pretty true for you, most of the stuff that's in here, because it's based on what we do every single day. None of this should be like a complete out of left field, like I never heard that before. Okay, so let's see. So infection control, the training goal of this is to, after completing it, you're going to be able to demonstrate best practices and answer why we do what we do, okay, in preparation for this exam. Okay, again, the biggest thing, I'll come back to it and keep saying it, it's learning the why behind what we do, okay? After completing the training components of this module, which is infection control, you should be able to summarize the key principles of infection prevention and control, identify types of precautions and modes of transmission, explain the technician's role in infection prevention and control as part of the patient care team, properly don and doff personal protective equipment, recognize how to stay safe as an ES technician, recognize how to keep patients, visitors in the facility safe, and recognize the particular challenges of working in healthcare. Okay, so you all have your books here. Okay, we're gonna first go to, let me pull up the slides for this module. Slideshow, module 1. Okay. All right, so you're gonna see this, this kind of set up quite a bit as we go through, and you'll see that outlined in green is module 1, infection prevention and review, and control rather. So we're gonna work through each of these modules, and you know, then when we get to module 10, wrap up and review, it's kind of a synopsis of everything we've done over the course of the 4 days. All right, so does everybody in this room know each other, by the way?
Yeah.
Okay, everybody know? Okay, I just want to make sure. And again, know that we had another group go through this in the fall. So there, or maybe late summer last year. When the heck was that?
Yes, that was probably like,
Ish.
It was March,
yes,
maybe.
summer, fall, yeah,
It was
summer.
March.
Was it March?
Well, they got you gave them, I think the
Certificates.
Yeah.
certificates.
All right,
March,
we
so
made
this
the
was Friday.
decision in late summer, fall of that, we made the positions and then we did the training in March. You're correct. So, once this is completed and we have our full group of 12 or more chest certified individuals, our plan and our goal for this is really to, again, to have you guys be the primary trainers of new staff coming in, because we want to get to a more consistent way of training. We want to make sure that everyone's kind of speaking the same language, everyone's kind of consistent in their approach to training, and that we have a set group of professional individuals who are our trainers. That doesn't mean we're never going to have anybody else train, because we just can't guarantee that. I mean, training still exists as a job description item in the ES worker job description. So everyone can train, but our go-to primary trainers will be the chest certified individuals. We also plan to have like regular meetings with the chest group, all right, to get you guys together in a room and talk about what's working, what's not working, things we can do to supplement our training. What are there things in the orientation process that we can do better to prepare the folks to go out there? Are there, we may even get to a point where we have some of our chest folks helping us with interviews for potential new workers. So we really want to work towards making you guys a leadership group within our department, all right, that has a say in how things go and can give us feedback and direction as we move forward and try to really, grow as a group, okay? So keep that in mind, and those are kind of some future goals for the chest certified individuals. So again, I talked to you, it's going to be about 4 hours. There's going to be a couple of 5-minute breaks during this. We ask that your cell phones and electronic devices be turned off, or at least set to vibrate. Don't be playing on them as we go through. You will miss something. All right. Make sure you're on page 1.6 in the participant guide. Is that where you're at?
Yep.
Okay. And okay. So this first section is going to be about 30 minutes. Okay. And this is kind of just the getting started section. So talked about that. Again, this is the longest session, so it might seem towards the end like, oh my gosh, when are we gonna move on to module 2? Once we get past this one, the other modules will seem like they go really fast, because they're each about an hour and a half to 2 long instead of 4. Okay, so what we want you to picture and think about is, this is your first day. Okay, so we're gonna review the basics, so you know why you clean and perform other tasks the way you do. Okay, so on page 1.5 there's some space that I think capture notes.
Yeah.
So if you want to write some notes or things like that as we go, you certainly can do that on page 1.5. Okay, and this is meant to be a discussion, okay, but it's also going to be more lecturing in this first module than the other sections you'll see. Okay, any questions before we jump in? Okay, so infections and harmful pathogens can spread through a facility, and they can impact many people, okay? If not prevented. Things like C. diff, things like that, they can spread really quickly through a facility if they're not prevented. Patients, visitors, healthcare workers can become sick. They can expose others if a facility is not properly cleaned and disinfected. And our goal is to prevent infection and harmful pathogens, which keeps people safe and saves the facility money, quite frankly. So we're going to watch a short story to see how pathogens can be spread in a healthcare facility.
Infection spread through the chain of infection. The chain of infection is made up of 6 different links. Infection occurs when each link is present in this order. And control to prevent.
Felicia, I'm wondering if you're gonna have to play this from your computer.
Oh.
I don't know, because it's not, because you're the one that's recording it. Essentially running the meeting, but let me try one more thing.
And control infection, first we need to understand how infections spread through the chain of infection. The chain of infection is made up of 6 different links. Infection occurs when each link is present in this order. But the chain is easy to break. Each link can be broken, which prevents disease and keeps patients safe. Let's go through each link. An infectious agent is an organism having the ability to cause disease. To break this link, seek prompt treatment if you are ill and use the right cleaning solution to disinfect the pathogens you have identified. The second link is a reservoir. A reservoir is where pathogens can thrive and reproduce, like tabletops and doorknobs and people. Break this link by washing your hands, keeping a clean environment, and disinfecting surfaces. Next in the chain is the portal of exit, which is how the pathogen leaves the reservoir, such as sneezes or coughs. Break this link by wearing personal protective equipment, washing your hands, properly disposing of trash, and covering your cough or sneeze. The fourth link is the mode of transmission. This is how pathogens are carried from one place to another, even on the hands of a healthcare worker. To break this link, wash your hands, control airflow in negative pressure rooms, disinfect surfaces, handle food properly, and observe isolation precautions. Next, the chain includes the portal of entry. It's the way pathogens enter the host, like breaks in the skin. Healthcare workers break this link by practicing aseptic technique during procedures, taking proper care of wounds, washing their hands, and properly caring for catheters. The last link in the chain of infection is the susceptible host. The host is a person who cannot defend against pathogens, such as the elderly or burn patients. Healthcare workers break this link by treating the primary disease and identifying those at higher risk for infection. As a healthcare environmental services technician, you can see how your daily duties give you many chances to break the chain and keep everyone safe from illness.
Okay, so I think I played those
To
videos
prevent
before,
and control
actually.
infection, first we need to understand how infections spread.
We're gonna stop that. Okay, so hang on, let me go back to videos here. I think I played those out of order. Keep that one in mind, because we're gonna come back.
Everyone knows
Watch this
infections are bad, but did you know just a few simple mistakes can spread pathogens throughout your healthcare facility? You start your day with a normal task, cleaning the restroom. While you are cleaning, germs stick to your gloves just like they would to your hands. Something simple like taking off your gloves can have a big impact. The pathogens from your hands are now passed on to all the surfaces you touch, like other supplies on your cart.
So, in that video, what were some things you noticed in that second video we watched? What did you see? Did you see anything people were doing wrong?
They don't know what's the hand.
Yes.
Right.
They were using gloves to open doors.
And touch people's personal property and things like that. Yeah, for sure. Anything else?
Oh, I recognized, how she used her hand to open the door
Right. Right. And
without a glove.
the other thing that remarks to me is they showed like 3 or 4 different scenarios, which are different things that probably usually people do every day. And maybe we're not mindful of it, but how quickly a pathogen can spread. Something that was on the glove, touched the book, the patient grabbed the book, all of a sudden it spread. It's just like that. You know, it could be within minutes. All right, it can happen very fast. It doesn't have to be something that sits around for a while and then takes hold on the patient. So good adherence to the basics of infection control could have prevented a lot of this, okay? Again, today's training covers a lot of these very important topics. Learning why it's important to follow proper procedure and prevent and control the spread of infection is a huge part of this training. And the longest part of this training is about preventing infections, all right? So infections can impact a facility in more ways than you think. Okay, we all play a very important role because in that first video I played, which was actually supposed to be the second video, but they're listed wrong. Okay. It talks about breaking the chain of infection. Okay, so breaking the chain is really a way that we every single day have an opportunity to do. Okay, all we need to do is break one part of that chain, and all of a sudden the infection cannot proceed. All right. So you don't have to break all 7 of them. You just have to break one of them. Okay. So what are some things you think you can do? And we're going to write these down. What are things you think you can do to help prevent the spread of infection or pathogens? Wash your hands. Number one. Number one. What else?
Yes.
Use gloves.
Use gloves when appropriate to use gloves.
Mhm.
Mhm.
What else about gloves?
Change it.
Change them.
Okay.
Yeah, don't put one pair on at 8 in the morning and think they're gonna last you till
No.
4:30.
Cannot do that.
When should you change them, you think?
After every use.
Yeah.
Right?
Because For me, when my hands get, if they get wet, because whatever, they quickly. I
Right.
don't do like a lot of gloves because
Right, so if they've been compromised and water's getting through them, what are some other times you should
it's not
change
even the
them?
water getting through them, it's just like not sweating, but from moving.
When you're grabbing garbage, you should always
Yeah,
change them.
definitely.
Change them in
That's
between
before-
grabbing
before it
trash.
goes from upstairs and then downstairs, yeah.
What other times? When else should you change, wash your hands and change your gloves?
Every room.
Every room,
Every
lots
room.
of rooms.
Right. Exactly.
Every room.
Yeah, this, I told you, this isn't stuff you don't know. This is, this is stuff we do every day. What about taking breaks? Before and after we eat, we should wash our hands, change our gloves, right? Okay. Okay. Any other things you can think of that we do to break the chain of infection or to reduce the spread of infection? What do we do? What, every single day, what do we do?
We wipe.
Yeah.
Wipe surfaces, right? That breaks the chain of infection because it's cleaning, cleaning up the surface.
Disinfecting.
Yeah. Okay. All right, so again, being an ES worker is an integral part of the patient care team. Okay, your job keeps patients safe, whether you know it or not. It's not, we certainly do a lot of stressing of engaging with patients and customer service and all that kind of thing. But a huge part, if not the biggest part of our job, is to keep patients safe by making their environments free from pathogens. Okay, and not only just patients, keep our staff safe as well. Okay, we do this by following the steps we've learned about how to clean and disinfect. Okay,
Yep.
So again, we're gonna talk a little bit more. Remember that video. Now is when I'm supposed to play the video for the chain of infection or getting to it. But we already did that, so we'll kind of bust into that section. Okay. The why behind some of our actions, like putting on gloves or cleaning over our bed table, are at the heart of infection control and prevention. Okay. This module reviews how pathogens are spread, how infections occur, common causes, the importance of not just carrying out cleaning tasks as assigned, but also knowing why your duties are so important to the safety of the people in this facility. Okay. So we're gonna talk about these things in this session. We're going to show how infection prevention and control is at the heart of every task we do essentially. And it'll help you connect the dots between the tasks that you perform and why you do them the way you do and how it keeps people from getting sick, okay? And we're gonna revisit the list of some of the list of things that you guys listed as we go through this, okay? All right. So I showed you the video. I need to re-show you the chain of infection video or you think you got it? Okay, let's go back to the slideshow because I think that's going to take us through stuff. Okay. So how can we help prevent infections? All right, we can start with, again, the tasks that we do. All right, we're going to learn about the why and why what we do promotes a clean, healthy, and safe environment. Okay, so the first thing on the chain of infection we talked about, there's these seven modes of transmission. When I say mode, that means just like a way to transmit it. All right.
Transmission?
Actually, there's six. I'm sorry, six.
Six
modes of transmission.
Six modes.
Six or links. Yeah.
Oh, links. That's what
Yeah,
you're
you
calling
call
them?
them either mode of transmission or links in the chain. Okay. Each link has to be there for someone to get sick. All right. So in order for anyone to get sick, you have to have all six of these things exist. All right. And conversely from that, if you break any one of them, someone won't get sick. All right. So we only need to break one. Okay. So our job is to really break the chain. All right. So as you saw in the video, there's a lot of opportunities to break the chain. So we're going to discuss each step and the role that we play in that. All right. Since all six links of the chain need to be in place for the infection to be transmitted, breaking one of them really isn't that hard. Okay. If we really look at it. All right. So we're going to talk about tools and chemicals. We're going to talk about proper processes and understanding how infections are spread so the chain is broken. All right. So let's review what we saw in the video a little bit. So the first link in the chain is the infectious agent or pathogen. You see that right up at the top. Okay, that's the first link. That's the thing that makes it an illness or makes people ill, whether it's bacteria, whether it's a spore, whether it's a virus, that is the infectious agent, okay? So, there's many pathogens all around us, okay? And we're gonna cover some of the most common ones that we see here in the hospital later on. But the ways you can break this link is either getting prompt treatment if you have the infectious agent, if you have the flu, if you have a cold, if you have something else that's an infectious agent, getting prompt treatment for yourself so you're not someone that's spreading it. Decontaminating or disinfecting a surface will help get rid of that infectious agent. And rapidly identifying organisms, which is really the job of infection prevention and control, for them to identify these areas where this stuff might exist. Okay, so what do you do that you think could break this chain of infection as an ES worker, the actual infectious agent? What do you think you do? How do you get rid of infectious agents?
Disinfect.
Right, disinfect surfaces. Okay, how do we disinfect surfaces?
Wait,
With
a wipe.
okay, which wipe?
Well, normally you like the peroxy wipe.
Yeah, that's our standard go-to all-purpose disinfectant for 99% of stuff. We're using peroxide. And what are we using bleach for?
For blood-borne passages.
No,
Contact plus. Yes.
Contact plus.
Yes. that
only
too.
for contact plus, okay?
In blood, right?
No, contact plus.
Oh,
Okay.
4, 5,
Well,
6 for blood?
Okay, so if blood's on the floor or something like that, we can use that. We can use that like in the OR. We work a lot in the OR, Kapil, so you're definitely using 456. The real answer is any of our chemicals are gonna kill 99% of everything that could be in blood,
Okay.
okay? Peroxide kills every single thing except for C. diff spores. That's the only thing you need bleach for, okay? And we'll talk more about the specifics as we go.
So it was contact rooms?
Using Contact Plus is the only thing we should be using bleach,
For
but using the
Contact Plus.
proper chemical, all right, will kill and eliminate these infectious agents, okay? Using the right chemicals and disinfectants for the organism, pay another way we can take care of this infection agent is by paying attention to door signs and that indicate what's going on in a certain room, okay? So the next piece of the chain is a reservoir, okay? Anyone know what reservoir means or what the word really
Water.
stands for?
Water, right?
Well, reservoir is basically what?
Something that keeps going, flowing.
It's basically like a vessel, you know?
Yeah.
Anything could be a reservoir. A reservoir is something that holds something, all right?
Okay.
So like this bottle's a reservoir for peroxide. That bottle's a reservoir for
Oh, okay.
water,
That-
okay?
that
So it's a
reservoir.
place that can hold
Okay.
these infectious agents, okay? It's a place where pathogens can grow, all right? So in healthcare, this is mainly from human sources, okay? The reservoir is typically a person, all right?
Oh,
This can
okay.
be, but it can be people, it can be water, it can be surfaces, it can be tabletops, it can be doorknobs. It can be, that's why we talk about those high touch surfaces. Those are all reservoirs. They're a place where pathogens can live and grow, okay?
So that can be a person.
So that reservoir can be a lot of different things. It's basically a place where this pathogen can grow, okay? So ways that we break this link. How do you think we can break this link, the reservoir? Let's think of it as like our high touch surfaces. How do we break this link?
Wipe down
Pay special attention to those high touch surfaces. Anything people can put their grubby hands on is a potential for spreading of infection. And if we break that, we just eliminated that as a possible source, okay? What's another way we can break this link? Thinking of that a reservoir could be a human. So let's say you're a human and you have a cold or you have the flu. What's a way you can, right? Masking, proper PPE is a good one. Proper infection practice, I guess, you know, they talk about
Yeah.
sneezing
going
in
in
your
your
elbow or
elbow.
those kind of things. Don't come to work if you're sick, you know, don't bring the reservoir here.
Yep.
That's another way, all right? So covering your coughs or sneeze, practicing hand hygiene, following good cleaning processes, yeah, those are all good ways to break this chain or this link in the chain. The next one is the portal of exit, okay? That means the way it leaves the reservoir. So while this hand sanitizer is in a reservoir, the cover's closed, it's not getting anywhere, it's not leaving. So it's doing nobody any harm. If there was a pathogen in here, it's covered, it's sealed, it's not hurting anybody because you can't get to it and it can't get to you, okay? So portal of exit, meaning the way it leaves the reservoir. Some examples might be, think about it, if a door handle is a portal or a reservoir rather, a portal of, then the portal of exit would be something that gets it from that door handle to another source. So what would that be? What would be a portal of exit?
Wiping that.
But how would that pathogen get off that doorknob and get to this table?
The person does that doorknob and does another.
Our grungy hands, just like you saw in the video. She had her gloves on and that's some sort of pathogen. She touched the door and then she touched the book, you know, and she touched the table, all those things. So that's how the portal of exit, it has to have a way to get from one thing to another. It doesn't just jump across the room from the door handle to the bed, to the overbed table. It has to move somehow, okay? So what are ways we can break this portal of exit?
Wiping.
Yeah, wipe it.
Keep it
Yeah.
from leaving.
And again, what did we say could be a portal of exit? Our hands. So we said it before. Way to break
your
this,
hands.
wash your hands. Proper hand hygiene, including proper glove use. Control of secretions or excretions or other bodily fluids. So if you have a cut, making sure it's like properly covered and bandaged, okay? Those kind of things. Okay. We're gonna discuss safety and preventative actions you can take, keep yourself and others safe from the spread of pathogens later in this section. The next link in the chain is mode of transmission, okay? So the mode of transmission is how the pathogen's carried from one place to another. So it sounds very similar to the portal of exit. So the portal of exit is really the act of you touching that doorknob and then getting it on your hand. The mode of transmission is you taking your hand that is now, you know, a portal of exit that has it, and then touching that other thing. So the mode of transmission is how we move it from one thing to another. So some examples might be, again, your hands could be an example of mode of transmission, or cleaning cloths that are dirty, that have already been used too much and don't have any remaining disinfectant on them, and we're trying to clean too much with one cloth and it has no disinfecting properties, we move that dirt then from one place, or that soil or that pathogen from one place to another with our dirty cloth. One of the reasons we moved to microfiber mops from the string mops in the patient areas was because, you're using that same mop for 2, 3, 4, 5 rooms. Now you have the potential to be moving things from one room to another versus using a flat mop for one room and you're not moving it to the next room. All right, so part of that thought process is the mode of transmission could be in that mop if it's too dirty to clean properly, okay? Other modes of transmission can be airflow. So in some of our airborne isolations, why we have those negative pressure rooms, okay, that's a mode of transmission in the air for certain airborne pathogens. And again, ways to break this link. How do you think we break this link? We talked about hand hygiene really for a lot of them. What's another one? I just talked about the negative pressure rooms. So what would that fall under in breaking this mode of transmission? What do we do here mechanically, or what do we do here as a practice to break this mode of transmission? What do we look at before we go into any patient room?
Oh, the sign on the door.
Yeah, the
Sign on the
signs on the door.
That tells us if there's something we need to be aware of to wear the right PPE.
Mhm.
So isolation precautions are a huge thing we do here to help break the mode of transmission, so we're not taking it from one place to another. We're gonna talk more about the specific isolation precautions when we get into some of the specific room cleaning processes. The next link in the chain is the portal of entry. All right, so this is the 5th link. All right, it's an opening that allows a pathogen to enter the body. Okay, also remember the importance of immunizations such as like Hep B, influenza, COVID, all right, to reduce the risk of transmission if exposed. So while we may be immunized against Hep B, we could still be exposed to it. We just might not get it because now we have the vaccination. All right. So that's one way that the portal of entry, even if it does enter us, if it does enter us, if we're vaccinated, we probably won't get sick. All right. So that's one way that if you don't break the chain of portal of entry and it still gets in somehow, if you're immunized, you can still not get sick. But examples of portal of entry could be breaks in the skin, a cut, any kind of lesion or wound that could allow things to get into your bloodstream. IVs for patients. That IV is an exposure point for potential pathogens to get in. That's why you see there's a lot of committees and things that happen in hospitals for reducing IV related infection, post-op infections, because the IV site is a portal of entry. Mucous membranes, eyes, mouth. Again, big reason why when we're dealing with potential splashing or things like that, we wear masks over our nose and mouth and potentially goggles over our eyes, because those are all portals of entry. Those are ways that infectious agents can get into our body. All right. So thinking of those openings and those areas where things can get into our body, what are ways to break this link that you can think of?
Wipe everything down.
That's always a way, but that doesn't necessarily stop things from getting into our body.
Oh, our body.
Yeah,
Oh,
that's gonna stop the thing from being infectious.
Yeah,
But-
okay,
But let's
okay.
say the thing is infectious, whatever it is.
Protect yourself.
Yes.
Protect yourself,
How?
yeah,
Use a PPE.
But if you use a PPE.
right? PPE, that's definitely a good way.
And wash the hand frequently.
Wash your hands, always, hand hygiene is gonna be an answer for just about every one of these, it really is, because that's the biggest way we break the chain of infection is by hand hygiene. Again, making sure the right PPE for the right job, so if you're doing something that you could potentially be splashed in your eyes, your mouth, your nose, your mucous membranes, make sure you have protection for that, okay? Face protection, things like that. Sometimes clinical staff will handle sterile objects that come in contact with patients, but you need to be aware of how this factors into the overall chain. So we may not handle the catheters or things like that they're taking out of patients, but we may handle it after they throw it in the red bag and handle that bag. So again, keeping that potential contaminated stuff away from our body, those type of things, we have to be aware of. Okay, the next. Okay. The last link here is susceptible host, okay? This means that not everyone who's exposed to an infectious agent or pathogen will become sick, okay? We talked a lot about this during the early days of COVID. Just because you're around someone with COVID doesn't mean you're gonna get COVID, okay? Just because you're around someone with the flu doesn't mean you're gonna get the flu. You have to be susceptible to it. You have to be unvaccinated. You have to probably have, certain low blood counts. Your immune system needs to be compromised in some way. That's the people that are typically they're susceptible. They're able to get sick when they come in contact with this. Okay, so not everyone who's exposed to infection will become ill. They may become carriers, okay? They can take it to somebody else, but so again, our big issue is we don't want to become carriers because our patients who we are near are highly immunocompromised. So just because we don't get sick from something doesn't mean we can't carry them to them and have them get really sick. So we do have to still be cautious about it. So again, currently the patients are at the most risk because they're sick. They have lack of sleep, they're under stress, they have illness that is causing them to potentially become more likely to be sick. So our patients are really the highest risk people we come in contact with. All right, so ways to break the link of a susceptible host. How do we break this link?
Wash your hands.
Good one, always. You can always say that, right? Another good way is for the doctors to really treat the primary disease, So, if someone has C. diff, treat the C. diff, so that person doesn't have it and then it doesn't get spread to others. Person has MRSA, treat that MRSA so that it's not potential to be spread to others. And then the other thing is make sure we're aware of high-risk patients. How can we be aware of high-risk patients?
Outside the door, I tell you.
Outside the door is one way. Here at Roswell, we have another way to really know.
Maintain the distance.
What's that?
Maintain the distance, like a 6 feet.
Oh, keep the distance. Yeah, no, that's a good thing. Maintain distance. Here at Roswell, we have specific floors that are of even higher risk. Becky works on one of them.
Right.
Our bone marrow transplant floors, we know those patients are extremely immunocompromised. So making sure those doors are closed, making sure we're really, really focused on our hand hygiene and our PPE when we're on those floors.
Okay.
So we're not spreading things. So being aware of the patient population can help eliminate, exposure by a susceptible host. Okay. So again, in just about every one of these links in the chain, we have a big part in potentially breaking that chain. All right. So just keep that in mind. Your job is uber important here and really has the potential to break any one of those 6 elements of the chain of infection. Okay. So the chain of infection it basically starts with one thing. All right. It starts with a pathogen. Okay. A pathogen is a microorganism that causes an infection. Okay. Microorganisms can include bacteria, viruses, fungi, and they're too small for us to see. We can't see them. We can't see bacteria, we can't see fungi, we can't see viruses, all right? But not all microorganisms are harmful, okay? So harmful microorganisms are called pathogens. Bacteria, mold, yeast, and viruses can cause healthcare-associated infections, okay? And drug resistance occurs when organisms become resistant to medications. So we hear things about MRSA. MRSA is a methicillin-resistant Staphylococcus aureus. I don't expect you to remember that, but that's what MRSA stands for. It means that it's a staph infection, essentially, that's resistant to penicillin or methicillin, any of the methicillins, which penicillin is one of them. Okay, so it means it's a staph infection that's resistant to the ways that we treat infection. All right, which makes it very hard to treat and cure. Okay, so the drug resistance is a big issue that we're seeing here of late, and as we develop new drugs to fight these infections, the infections are getting smart and they're outsmarting the drugs and they're starting to kind of be resistant to them. So some are resistant to several antibiotics. They're called multi-drug resistant organisms. MDROs, okay?
Mhm.
Some examples, again, are MRSA, vancomycin resistant enterococcus, VRE. You probably heard of VRE around here as well. And many can survive on surfaces in an environment for extended periods of time. They require effective cleaning and disinfection to be removed, okay? So some are harder to kill than others. And let's go through some of these pathogens that you're most likely to encounter. So you'll see this grid, and it's in your book as well. And it talks about what the different pathogens are, from prions to bacterial spores, mycobacteria, non-lipid or small viruses, fungi, vegetative bacteria, lipid or medium viruses. Those are typically the pathogens within a healthcare environment that we're gonna see that could be resistant to disinfectants. So example of some of these, HIV is a lipid or medium virus, okay? You can see the things that kill it. Basically, it's anything from low level disinfection all the way over to high level disinfection. So low level disinfection are your quats, okay? Quat disinfectant, or, okay? We don't really have a quat. We don't really use any
No.
low level disinfectants.
Yeah.
We have an intermediate level disinfection, which is our A456. That's a quat alcohol blend, okay? The 456 is a medium or intermediate level disinfectant, okay? It kills a lot of stuff. You can see HIV, MRSA, VRE, athlete's foot, right up to norovirus. Kills a lot of stuff, okay? What it doesn't do is doesn't kill all the stuff, and it has a very long dwell time to kill a lot of things. That's why we moved away from it, all right? So it will kill the things, it just has to sit there for a while to kill it. All right, makes sense? Then you've got like our bleach and hydrogen peroxide, which are our primary disinfectants. And you can see, they kind of bridge between intermediate level and high level disinfection. And they kill everything up to C. diff, the bleach specifically. The peroxide will kill C. diff basically as a bacteria. It will not kill the spores that cause C. diff. So while the spores can get into a person's colon and cause stool issues, it will kill any kind of compromised C. diff, but it's not going to kill the spores. And the spores can live on a surface for 6 to 12 months if we don't kill them with the bleach. That's why we use bleach for C. diff, okay? Because it's a spore. And you see anything below here is killed by the peroxide wipes, okay? And then high level disinfection, the peracetic acid, hydrogen peroxide blends. We don't really live in that world a lot. That's more stuff that you'd see in SPD for where they're sterilizing equipment, sterilizing utensils that are used in a wound, those type of scalpels and things like that. So we don't really deal in the high level disinfection. That's more of a sterilization process. And we really luckily haven't seen any prions really in our environment. Mad cow disease, we don't really see that in this country. So again, these range from easy to kill, things like HIV, MRSA, VRE, athlete's foot, norovirus, examples of these things, very relatively easy to kill. And until you get up to really hard to kill stuff like, again, C. diff is almost at the top of the list. You know, that's why we use bleach for it. All right. Okay. Just keep in mind too, that the disinfectants we use, it's not just something that like Felicia and I come up with and we say, hey, this will be good, let's try this, you know? These are vetted through not only testing in a lab environment, through the companies that provide them, but they are also vetted by our infection control. We don't bring any chemical into place here at Roswell unless infection control has reviewed its efficacy and has authorized us to use it. All right, so we don't ever change disinfectants, we don't ever change chemicals unless we've gone through a full vetting by infection prevention and control here. So never bring disinfectants from home, never bring cleaners from home. We go out and do rounds, we find stuff from the Dollar Tree, we find orange solvents and 409 and Lord knows what the hell else we find out there, but it's not proven to be effective against these things. And we're working in a healthcare environment, as we mentioned, with sick people. We have a different burden than you have at your house, okay? You certainly, I'm sure, 409 or Fantastic or whatever the Maze Clean or whatever the heck we get at the dollar store, that's all well and good for your house, because most people in your house are not immunocompromised. Most people in your house are not sick in most of the time. So you're not really trying to kill things on a large scale. You're just trying to keep the place clean and keep people from being grungy and gross. But in a hospital, we have to use the approved chemicals that are here for a reason. Okay. So the next thing we're going to talk about is some very specific things that cause infection that we see here at a hospital. Okay, one thing is spore-forming bacteria. Okay, and one of the big spore-forming bacteria that we see is called Clostridium difficile. Okay, you will hear it called C. diff. All right, but the technical scientific name is Clostridium difficile. It's a spore-forming bacteria. Okay, that's the important part of it, is that it forms a spore. Okay, and it can be life-threatening. It really can. Most common symptoms include watery diarrhea, abdominal pain and tenderness, fever, loss of appetite, and nausea. But it can cause someone to become so dehydrated that they pass if someone's already sick from something else. So it can be very, very bad for a hospital like ours, where people are already sick and compromised. Another place that's can be really, really bad is, say, a nursing home, where you've got a lot of elderly folks that are already suffering from a lot of other ailments, that it can run through places like that and really cause a lot of damage. So they can survive on surface. The spores can survive on surfaces for months, okay, if they're not properly cleaned and disinfected. Okay, that's why we pay such close attention to those high-touch surfaces, to things that, nurse call buttons, bed rails, things like that. Because if there's a spore on there, we got to hit it with bleach, or it's going to sit there it could be there for 6 months if we don't clean it
What
right.
about the floor? Remember I asked you that again? So
We'll get to that, but the floor,
it's not saying that it comes with a spore,
people are not rolling around on the floor.
but they do with no shoes on. I seen them,
Yeah,
no socks.
yeah, they shouldn't be. And they shouldn't be on the floor with no shoes on, with open wounds or sores or cuts on their feet either. Not saying they don't, but they shouldn't be. So if you see it, you may want to, let the nurse know, hey, maybe recommend a patient, in room whatever, to put their socks or put their those little sticky socks they give them or whatever. But the likelihood of things being transmitted from the floor is very, very slim, very slim. Because number one, not only are they not rolling around on the floor near where their open wounds are, but if they're walking with bare feet and they happen to have a cut, chances of the actual pathogen being on the floor, like C. diff, in an amount, they'd have to basically poop on the floor and
I was gonna say, what if
not
they
have us
did?
clean it up.
What if they did and the nurse cleaned it up?
Well, they're supposed to be calling us. And there's a lot of what ifs, but for the most part, we do a great job here of not having, we had one C. diff outbreak probably back in 2015.
Around there.
Yeah, it was around 15.
Yeah, I mean, that's 7 years ago now. So we've done a pretty darn good job of mitigating C. diff in our place. So what we don't want to do is we want to keep sound practices that reduce the risk in most cases, but we're not going to create something that fixes something that isn't broken. We're going to say mop all the floors with bleach just in case, because the just in case doesn't really happen. Could it happen? Probably, sure, but the chances are it's not going to happen. And if we saw that it did, and we saw that we think that was happening, we might approach it a different way. We might then go to an escalated type of cleaning in those areas. But right now, the process we're using is pretty sound, and it's not resulting in any outbreaks. So again, primarily C. diff spores, it's spread from environmental contamination via hands of a healthcare professional. That's the primary way it's spread, is from hands, from hand contact. Contact with surfaces, contact with other people. That's typically the way it's passed. So we're following proper PPE, obviously, is a way we keep this from spreading. What's another way you think you can keep it from spreading?
Wipe everything down
With what?
with bleach wipes.
Yeah. What else do we do when we see a C. diff room? Well, you guys know this from being on the floors. What does infection control do or tell us to do when there's a room with C. diff?
Well, before, I think, I'm not for sure, was it a C diff room that they had us do a cleaning?
Yeah, a lot of times we'll do like an extra bleach wipe after we go through and disinfect. But what do they do with everyone's hand hygiene with a C diff room or a contact plus room?
Dress up.
No, I'm speaking specifically of hands.
Wash the hand.
Wash them
Wash them with what?
with soapy water, it says it.
Water, so.
Not use
So,
the
not the
Purell.
Purell, exactly.
You gotta use
So,
water.
For C. diff, we do not use the Purell because the alcohol does not necessarily kill
Yeah, soap
the
and water.
spores. Soap and water, and why do you think soap and water?
Less away.
And wash it away, yeah.
Well, the important part of it is the away part, okay?
And then it's
Because when you're washing,
friction.
the friction is important, the soap is important, but the away part of washing away. You rinse it down the
Soap and
drain.
water wash
You're
away.
actually rinsing it off of your hands down the drain versus the hand sanitizer, you're just rubbing it around. You haven't rinsed anything off, it's all still there. So
Okay.
even if there was a spore that happened to not get killed from the friction or the soap, you're then rinsing it down the drain because you're actually washing your hands.
Okay.
So that's why they go with soap and water, to give you the biggest chance of killing and then washing away the potential spores, okay? Effective cleaning in the patient room, what else can you think of that, that we do? We just talked about it, the reason we use what versus what do we use to clean with?
Bleach wipes.
Bleach wipes, exactly. So using bleach instead of the peroxide because it will kill the spores, okay? So if you don't get rid of what they call the bioburden, that's like the volume of stuff that's on a surface, okay? We don't disinfect effectively, all right? So we have to get rid of that bioburden. We have to make sure we use the friction and the proper cleaning chemical, all right, to get rid of the contamination on a surface. There are some things that are out there besides bleach that do kill C. diff. There's some parasitic stuff. There's other chemicals that do kill, but bleach is one that kind of is the most broad spectrum. It's the most easily used and used more widely across healthcare institutes.
I'm missing one to prevent too. What do you do with your tools that you use to clean the room?
Wipe them down,
You have to, yep, you definitely have to do those.
Yeah.
wipe them down. Wipe down tools.
Clean and disinfect equipment prior to removing it from the room.
Mhm.
So we're not bringing that out into the hall. We're not putting it into the next room.
Yeah.
Okay, next one is norovirus. Okay, we're gonna talk about, okay, so norovirus are a group of highly contagious viruses that can cause acute gastroenteritis, sometimes incorrectly known as the flu. Okay, symptoms can include acute onset vomiting, diarrhea, abdominal cramps, nausea, headache, fever, and dehydration. Norovirus commonly causes outbreaks on cruise ships. You hear about it a lot on cruise ships, in schools, and in healthcare settings. Okay, norovirus. It can survive freezing and heating to 60 degrees Celsius, which is 140 degrees Fahrenheit, in healthcare facilities. So even like steaming it typically doesn't kill it. It can live in very hot conditions and very cold conditions. Soap and water hand hygiene is preferred in this method as well, in this case as well. Okay, and then what do you think you do to prevent the spread of norovirus?
Wash your hands.
What else? Soap and water.
And soap and water.
Yeah. And
And
again, what else do we
everything
what do
down.
we do? Wipe everything down with what?
with the peroxide.
Yes, correct. So peroxide wipes will kill norovirus, all right? The only thing we really need to use our bleach wipes for is the C. diff or the Contact Plus. All right, so yeah, wiping high touch surfaces, making sure that we are really focusing on those things. Okay. Another one I talk about quickly is, I always pronounce this one wrong, Acinetobacter, that's what it is, Acinetobacter, okay? We don't see this here a lot, but at this specific facility, but it is something in healthcare that you can get outbreaks on, okay? It's an environmentally hardy bacteria that causes a variety of diseases ranging from pneumonia to serious blood or wound infections. And symptoms vary based on the person's disease. Okay, can survive for days to months on a surface. Acinetobacter can become resistant to antibiotics, then known as a multi-drug resistant organism, similar to MRSA and VRE. Okay, again, the same way we clean, make sure we pay attention to high-touch surfaces and equipment, and make sure we're using the proper peroxide wipes to clean this as well. All right. Another one is Staph aureus, and again, including methicillin-resistant Staph aureus. So at MRSA is methicillin-resistant Staphylococcus aureus. Staphylococcus aureus all by itself is a type of bacteria, basically a staph infection, okay? And it's a dangerous type of staph infection, commonly found on the skin and in the nose. And it's typically resistant to certain antibiotics. It can cause skin abscesses, pneumonia, surgical wound infections, can survive on healthcare surfaces for days to months. Okay, and when it becomes resistant to antibiotics, it's an example of a multi-drug resistant organism. Okay, some symptoms are like foul odor, fever, and then redness around the affected area. Okay, what do you think you can do to prevent the spread of MRSA?
Yeah, oh, you definitely gotta wear your PPE.
Wear your PPE. Okay, use the right chemical. We talked about that with all of these, all right? Another big one with MRSA is, making sure that not only we're using proper PPE and hand hygiene, but that we're protecting any like cuts or abrasions or open cuts or wounds that we have, okay? Make sure that we're not setting it up for spreading within the healthcare environment. Enterococci. Enterococci are bacteria that live in the intestines and on the skin. Okay, they're associated with a variety of infections, including bloodstream, urinary tract, wound infections. Very often they're resistant to antibiotics. Symptoms vary depending on the disease, but sometimes patients don't have any symptoms at all, and they could have this. But it can survive for days to years on surfaces. And it's another example of potential multi-drug resistant organism. So proper disinfection of high-touch areas is critical as a prevention measure. But it's not just big, scary sounding pathogens that can cause issues in a healthcare setting. I mean, these things all have these scientific names. They sound all real scary, but typically with good cleaning practice, and using the right disinfectant and good practice of moving our equipment from one place to another, we can kill these things pretty easily. All right. So while they sound big and scary, there's something as simple as like a sneeze that can have as big an impact as these things do. Okay. Another way infection can get started is through employees bringing pathogens to work. Okay. So that's something we're going to talk about. It's not just always all these viruses. It could be an employee bringing this stuff to work. So we can be spreading infection. So what's wrong with this picture that you see here?
She not use this.
Yeah.
What else?
And she not.
She's not sneezing into her arm, covering her sneeze. She's letting it just go right through her fingers.
Yeah.
Not only is she contaminating her hand, but she's letting it get through into the air. What else? So what happens if when she sneezes?
To cover her mouth.
Right, but what happens after to whatever she sneezes out?
Whatever she sneezed on is still there.
Hey, it goes out into the room. So if she's sick, she's spreading her stuff through the whole room, right?
She spreads, yeah.
Okay. So some things to remember: cover your mouth and nose with a tissue or your elbow when coughing and sneezing. So they say your elbow, it's actually the inside of your elbow. They call it the vampire move. Okay. Count Dracula.
Yeah.
Sneeze into your elbow, okay? Use the nearest trash can to dispose of the tissue after use. So don't like stick in your pocket and then every time you stick your hand in there, you're touching a dirty tissue. All right, throw it away. We'll make more. All right. Perform hand hygiene after having contact with respiratory secretions and contaminated objects and materials. Okay? All right. So, anyone who has signs and symptoms of respiratory infection, a cold, anything like that, cover your mouth and nose with a tissue. We just reviewed all that. Okay. And you notice around the campus, mostly in the lobby areas and things like that, we have a lot of those Purell stands that also have like tissues on them
Yes.
and masks now. Okay, those are really to encourage proper respiratory etiquette for our visitors as well as having the hand sanitizer on them. And, and throughout the facility, especially in the clinics, we also have a lot of sinks everywhere for hand hygiene. All right, so those are ways that we try to help the employees to practice having a lot of areas for them to wash their hands. Those sinks out in the hallway versus having to go all the way to the break room or the bathroom to wash their hands. Okay. All right. So now you know a lot of the basics of infections, how they're spread and the pathogens that cause them. Okay, that knowledge is going to go a long way to help you prevent infection. But we're going to look at some other behaviors that control and prevent infections. Okay, so how else do you think we can prevent and control infections besides some of the things we talked about, the wiping the surfaces, stuff like that?
How could we?
Yeah.
Yeah. Still wash your hands.
Yeah. The answers are on the board. Okay, so know what the pathogens are. Okay, we just reviewed a few of the common ones that we see. Follow the right steps, follow what you've been shown and taught.
Yeah.
Wear your PPE properly and the proper PPE for the proper job. And hand hygiene, okay? And we follow these procedures, again, talking about the procedures, following the cleaning steps and doing them properly. We talk about that because the steps that we teach, the 7 steps, are really designed not only to cover the entire area, and make sure nothing's missed, but it's also designed to make sure we're not going back over things and recontaminating. So that's why you're working top to bottom and back to front, all right, in your rooms. If you go through and you clean the floor as the first thing you do, and then you go high dust, well, what did you just do? You just recontaminated the floor you just mopped, because all the stuff that you didn't get on your sticky duster just fell on the floor. All right, so that's why we work from top to bottom and from back to front. Okay, so following the steps in order is very important. We're gonna talk a lot more about that when we get to specifics about patient room cleaning. Okay? All right, so again, we're gonna start with the actions we do every day, cleaning and disinfecting. In order to properly clean or disinfect surfaces, we first need to know whether they.
Wait, did everybody fill in the answers on the page? What page
Oh, I
is
didn't
that?
fill in the answers.
See, they don't tell me that you.
That's okay, I got you.
Okay.
So page 1.27, the first one, don't come to work.
If you're sick.
Yep, there you go. And what do we wear?
PPE.
There we go.
Okay.
Okay.
So the things they give you. Oh, why do we do these things? We talked about
Yeah.
breaking the chain, breaking a link in the chain. Okay, and making sure that we're not passing things around here, and that we're stopping it before it gets on to the next person. Okay. All right.
Oh, sure. Oh, restroom break?
Yeah, we can take a little, this is a perfect spot to take a break.
Perfect.
So let's take a little break and we will, we'll come back in 5 minutes.
Okay.
47,
You know where they are, right around the down.
5 minutes.
so like 10:52-ish.
Yeah, I'm just gonna wait for her to finish and then I'll.
There's 2.
Oh, yeah, that's right.
Making sure you don't want like a little granola, that way these mini granola bars.
Yeah, I'll take,
No,
they got, what's the name of the donut?
what?
Nuts.
Yeah, or we have pop tart?
I'll take.
Yeah.
And for lunch, so we get Maddie working on lunch
Yeah.
for us.
Yeah, that'd be a good idea.
We're just going to pizza for today. Is that okay with
Sounds
everybody?
good.
Any preferences for toppings? Everybody want no meat or anything like that? Should I get some cheese?
Yeah.
Chicken.
Some cheese, some pepperoni?
Yeah, I would put half and
Half and half and then
Do you,
some.
do you not eat pepperoni?
No, I eat.
Or
pepperoni.
everybody does except for Capil, maybe a quarter.
Yep.
You don't eat meat?
I eat pepperoni.
Oh, you do eat?
Yeah,
Then
cause I was gonna say, I
everybody-
seen them eat it before.
Oh, then everybody does, then.
Okay.
Yeah, let's just get a pepperoni
Yeah,
pizza.
cause it,
Some wings,
yeah.
okay, gotcha.
Wings, everybody like hot or no?
Yeah, it don't matter. I don't care for
Yeah.
the wings today. so.
Yep.
I'm not supposed to eat like a pepperoni, but
Oh, you're not?
yeah,
Oh, it's against your religion?
yeah.
No, pork, cause it's
Yeah.
pork.
We just eat goat and then chicken.
Yes, I know goat is good.
Yeah.
I like goat.
But I do it, you know what I mean?
Yeah.
It's
You know, they do have what they call turkey
Yeah, yeah.
pepperoni.
That's
Just
fine.
take it off.
Yeah.
Yeah, you
No,
can take
no,
it.
that's fine. If,
Oh.
like, if we have to be a vegetarian, but if we eat meat, like, just eat a couple of more.
Yeah, that's
all.
it.
Yeah.
Yeah, don't overdo it.
Yeah. I try, but I can't be the vegetarian.
No.
Yeah. like, you know what I mean?
You
I
tried?
Yeah, I try, but
Yeah, me too. I try to do a lot of things and
yeah.
it's just not there. I'll wait and then I'm gonna go and then, cause I wanna call my doctor. Let her know that I took my 2 doses of medicine this morning. Mhm.
I'm not, I'm myself tomorrow, but
Yeah, go ahead, you go. I'll come back.
Yeah, I will go.
Oh, all right, okay. Let me just write this. Try to do this.
what's wrong with this?
I'm gonna get internal. Internal medicine. Internal medicine.
How come we?
Yeah, so I was trying to get internal medicine.
Really, this is the only time for y'all, right?
I know.
Very cool.
What time it is? I don't know,
10:52.
10:52?
Yeah.
Damn,
I was
Yeah.
looking
they
before.
lose so long.
I was sitting there, I was like, damn, it's only 10.
I
First-
know.
First when you started, look like it was going for a while, I was like, 9:50.
I thought I was more later than that.
So we had, we didn't get a break, a first break, I guess we're gonna get a little longer lunch break. So most of it is bleach water, right? For the MRSA?
Mhm.
Well, these are gonna be multiple choice on the things, so.
But the thing is, for me, after this, the time in between when you take the test, it's not like you finish this and then just take this.
Oh, you just gotta remember.
Yeah, see, so that's good.
You'll know that, though.
Okay.
Sorry.
Oh, it's okay.
I wanted to let my doctor know I took two pills this morning,
Okay.
so he can get back in touch with me and let me know that, okay, how you feel now?
Yeah.
Oh, you're about to move it out of the parking lot?
I never even knew that this was,
Okay.
a lot of this was our concern.
Yeah,
Where's
we're
that?
we're very important. We're breaking the chain of infection.
No.
We are extremely important.
Well, what about the nurses' aides that come around and they do the weights on the patient? They don't, sometimes I don't see them wipe them damn things down
They're supposed to.
after each one.
Absolutely, after each patient.
And then when they have a C. diff one, cause I was wondering how the C. diff was spreading on my floor, that's why I kept mentioning the floor.
Yeah.
Cause they kept saying, I wonder how, and they kept saying it was.
Okay, that's,
You know they
that's
kept
the
saying it
board,
was-
union town, right?
So I kept saying, it's not me, I know it's not me. I said, it's gotta be the nurse's aide, that they're not switching out those things when they do the blood pressure, they're not switching out, they're not cleaning off the things when they weigh the
It could
people.
be a bunch of different, it could be the doctor coming in, if the doctor has a tie on and he leans over to the patient and then goes into another room and does that. It could be so many things, yeah.
Yeah, but we kept, every patient that came in that room got
Mhm.
that C. diff.
Mm-hmm,
And they didn't, so when I did that floor, it
Yeah.
went away.
mm-hmm.
That's why I keep asking.
Yeah,
"You
no, cause no
sure?"
one's, yes, no, the floor has nothing to do with it. So the
So-
patient's not touching the floor, then touching his mouth, touching his, getting in it. That just doesn't happen,
Okay.
yeah.
Well, me and the nurse said that. We were like, well, what if? I was like,
Yeah.
I'll do the floor
Yeah.
just so it could stop.
Mhm.
And it did stop, but I
Yeah,
don't know
that-
if
that's-
it
that
had
has
nothing to do with that
it.
floor.
No, it didn't.
Okay. I had a feeling it didn't, but it was comforting her.
Mhm.
When they taking out that,
What?
that, ATM machine in the, parking garage that everybody use?
Oh, they are?
Yeah,
Are they replacing it?
no, they just.
It's not gonna be there no more?
No, cause you know, everybody use it for free, like, but, so she just told me some places where I could use.
Yeah,
my
cause it's free.
Credit union card at,
Mhm.
and then they gonna send me a $50 Amazon card or something,
Oh, nice.
just, but I'm not having it, I mean, I already use it like one time in there anyway. So, but they can send that.
Yeah, they can send that right, that'll come in handy.
Yeah,
I wish they send those all of us more.
it probably
Okay?
is, whoever got in the credit union. they
I'm in
use
the
that
credit
machine.
union.
Mm-hmm.
Yeah, but
I just
I
have
let
to
mine
call them.
expire, I think, cause I
Yeah,
didn't
well,
put
that's
enough
fine.
money in it. I didn't keep putting money in it.
Oh, in, credit union?
And he did call and verify and ask me, did I want it, and I forgot to do it. I think it's gone,
I put money in there every
cause
check.
I didn't get a new card, so I know it's
Like 2
gone.
years, I think I took like $20 out, and that's it, so I think I got like 1,000 something in there already, in like a year.
No, but you okayed yours, that's what, cause they send you a paper every 2 years, they told me that. They said, we sent you a paper, I said, you probably did, I did see a paper. When, after he sent it. So I didn't get mine recertified, I gotta do it again.
Yeah, I'm sure Wanda will. We'll give her one more minute, then we'll get started.
Okay.
Oh, you taking over from here?
Yeah, Matt just had to run, oh, well, just for a little bit, Matt, I
Okay.
usually do the notes, cause he can't really stand up and write and take notes with his foot, so, but he'll be right back. Alrighty, so we're gonna talk about Spalding classifications.
Okay.
That's just a classification of how we classify like the use of like disinfection of critical, then they have like 3 different classifications here. Let's see, sterile, which is, we don't really see, we don't do anything with sterile, that's more SPD. And that's like the top of the classifications for disinfection. Then after sterile, there's high level disinfection, and still, we don't really live in that world either. We're sterile high level, that's more SPD. That's like you would say that's like typical for surgical instruments or devices that come in contact with mucous membranes of a patient.
Sorry to interrupt.
No problem.
They're closed today.
Oh, they're closed. Oh, okay. You know what? One moment, please, guys. I gotta make sure this is important. It's about our lunch.
Okay. It's no, that's just a high level, so we really don't deal with these, neither one of these. We're low level. We get the red one, the non-critical. That's immediate, low, yeah. Loaded, okay. Actions. I hope this is gonna be easy, get it done, get it over with, right? I hope so.
But I don't know, what is the question model, like how they ask the question?
Yeah, it all depends on how they ask the question, that's what's gonna confuse me. I already know that, cause I don't like that.
If they put.
I don't like it either.
That's fine, but
The way they ask you the questions and this asks me to straight out, don't give me those other words.
But it's gonna be multiple choice. And
Yeah,
you just
but
gonna have
like,
to pick, you know what I mean?
on a
Right.
sentence, they ask on a questions,
Yeah.
like,
There's no fill in the
Yeah.
blank?
No,
I
I
think
don't
that's
think,
the
there's gonna be
multiple
50
choice.
multiple choices and you just pick A, B, or C, I think.
Oh,
So
okay.
that's gonna be the whole.
So
thing.
our pizza place is closed, they close down on Mondays,
Okay.
something,
alright.
so we'll order, does everyone like Rachel's?
Yeah, I'll take Rachel's.
Okay, so can everybody just write down their orders for me? Then I'll get Maddie on it to,
Like chicken.
What is a ratio?
Rachel's, yeah,
The Mediterranean.
have it.
thing.
yeah, it's up, they have like salads, chicken, and,
Salads and stuff.
Yeah.
you have your phone, you can pull up their menu. Some healthy, rice bowls, yeah, rice bowls,
Check that out.
yeah, yeah.
But, yeah, that'll work.
Yeah, they do have rice bowls.
Yeah, good
What's
rice.
What it called?
I know people.
Rachel's.
Rachel,
Places that have rice bowls, they never have brown rice.
oh, they have brown
They do
rice,
it? Oh, good, cause then that'd be nice. Just,
They got chicken sabaki, right? I get that.
yeah, what, we need a little more description, what's your toppings?
It's just, whenever you say chicken sabaki, whatever they got in everything.
Yeah, it comes with everything.
You sure you want everything?
I mean, like, what's everything?
Okay, so you want a bowl with like rice? So.
They
you
come with
want-
rice too?
Mhm,
All right, whatever.
okay. Rice, okay, peppers,
Yeah,
onions,
yes,
cheese,
yes,
you like feta or
yes, better,
Greek dressing?
yes.
What other things, anything, any other toppings you could think, banana peppers or just regular peppers?
This right.
See right here? That's the menu. That's one of the rices.
no. Yeah, I think I go with him, like, that's right.
Chicken is good?
Yeah.
It looks like I'm gonna go with the mixed green,
Mixed veg, yeah,
mixed
no. That
green.
come with the only chicken, right now?
Yep, or you can get, you can get vegetarian, or you could get, they have another type
Yeah,
of
I
meat
get
too.
chicken.
Okay.
Same thing.
Same thing as Maurice?
Yeah.
Okay, peppers, onions, feta, cheese,
yeah, that's
dressing, okay. No,
And I'm getting the mixed greens.
okay, okay.
Mine's is called mixed green bowl, salad bowl.
Okay. Yes, seems good.
I can't get a connection here, so I can't see.
My internet is.
Might as well come, yeah, I can't. see the
Yours won't come up?
Yeah, I can't.
Here you go, I got mine's up.
Okay, good. Let me see what-
And this is their bowls, if you're
Yeah, I was
looking for bowls.
maybe.
See, that's Greek fries.
Mhm.
They have vegetable bowl. You see that's the one I just ordered.
What's that?
And that's a mixed green
So what
salad
else is
bowl.
in it though? Just a salad?
Yeah, and you get feta, you get onion. And then you got the Greek salad.
Did yours
mix,
come up,
or you
Wanda?
get-
Yeah. Right
Okay,
there, right?
okay, perfect, yep, that's it.
But they have rice bowls, that's what I'm
Yeah.
looking for, but.
I'm gonna get maybe
Greek
the
salad.
Okay.
Okay, let me see what.
Yeah, 'cause I wanna-
And my chicken.
Okay,
Yeah,
here
I'll
it
write
is,
it
right
on
here,
here.
brown rice.
Okay, but what's in it?
Okay, I'm gonna find out.
Okay.
Oh, gluten free,
Yeah,
it's all natural. Okay, well, you wanted a brown rice bowl?
is there anything else in it though? Just.
It says that.
What'd you like?
What is the topping?
Maria.
What'd you like?
It should tell you.
Yeah.
Yeah, that's what I see.
Okay.
I've tried to pull it up, but.
But this is the only thing
What
that
is
keeps
this?
showing.
That's falafel. You wanna see grilled veggies?
Let's see, but I don't know what's in it, that's the only thing.
Tomato.
I can't even get that far, I tried to pull up Richard's restaurant, man.
Let me see what
Bueno,
you can get this one, the romaine lettuce one. It comes with chopped romaine side of grilled pita and a house dressing.
I can't figure it out.
You can't figure it out.
Yes.
They never ate
What is it?
Richard's before.
They had those.
It's not bad. I had it
I know,
before. You wanna try? Okay, let's see. What else could you try?
I was thinking about the rice bowl, but I thought.
¿De qué outfit? ¿Las cheese o no?
The rice bowl?
No, I can't get it to come up. I tried to pull up Rachel's. Well, actually, I tried to do the voice thing. Rachel's Mediterranean Restaurant.
Yes.
I'm seeing it won't go through because.
I never eat in this place.
Just trying.
Yeah.
I know we had to do a last minute thing, cause I'm like, what, they're closed on Mondays, they're
I
never
know,
closed.
right?
Maybe
It's
they
weird.
just
Maybe
changed it.
cleaning or something.
Oh, I forgot to ask, did you want tomatoes or cucumber? or no?
Yes.
Yeah, okay, I forgot to put, you two could be, no? Okay, Mo,
You
okay.
didn't
I
get it.
did Rachel's Restaurant, but it wouldn't come up still.
Oh, I love that.
I'm just trying to see.
What is it?
Yeah,
What's
the
it?
individual thing, that's why I don't know, like.
Vaca.
You wanna do that too?
Oh my
Yeah,
God,
put that on
I
yours.
love that.
Okay, let me see.
Did you ever
You-
try
Which one
it?
you think you like?
Yes.
Which one
Oh
look
my
good to you?
goodness.
No, they all look
Vegetable?
good.
Oh, just try this one.
Yeah, mixed green bowls. Do they put meat in or just greens?
This is how it's gonna come. And it's gonna come with,
I don't like the banana peppers in.
oh, you don't gotta get,
I know.
oh, you don't want that.
Yeah, I don't want the peppers
Yeah.
and stuff. I don't
Yeah,
even know.
that's what it is. It's banana, it is gonna be banana pepper.
See, I don't want.
But you can say minus, right? You can say minus banana peppers?
Yeah, say no banana pepper.
No, I was showing her how
I
they
was trying to
look.
see
Oh,
what to
yeah.
get,
But she
'cause I
was
can't
trying
get
to
the
see
full
what-
menu, yeah.
Oh, okay.
Cause I
What's
was looking at a
inside?
rice bowl.
What, you want,
I was looking at a rice bowl,
okay,
but
did you
then
start
it-
writing what you want down?
No, but it didn't have like, I couldn't see the Pacifics.
Oh, no,
like-
you don't have, you don't have, no, it is, so you want a rice bowl, Sharita?
What is that? Is that
That's a
what that-
rice bowl.
No, just tell me what you want on yours and I'll just have her
Yeah,
order
she'll
it.
have it, put it
Just
on
what
there.
you want,
Yeah,
rice.
just
Just
say
what you
rice and
Brown
then.
rice?
Brown rice.
Yeah.
Mhm.
What else?
Brown, you want chicken?
Yeah, okay, chicken.
Yeah, that's how they do it.
Okay, tomato,
Yeah, tomato.
Okay,
onion,
Mm,
peppers,
no.
grilled,
pepper.
you want grilled peppers?
Not hot peppers though.
Do you want regular grilled peppers? Like,
Those are sweet peppers like
Yeah.
green, yeah,
Okay, sweet peppers.
not hot peppers.
you want cheese?
Okay,
Feta or American?
it doesn't matter.
Okay.
You like feta?
Well, I like feta too, but
Yeah.
I'm just, but I, yeah, cause I
You
have,
want Greek dressing?
okay, I have a dairy age, so I
Yeah.
probably won't need that till the night sometime.
Yeah.
Okay, I got you.
That's what that dairy age without.
Cucumber?
Yes.
Okay, there we go. You got yours,
Yeah,
Rebecca?
yeah, I got my mix, I'm just getting a mixed green bowl right there.
Okay.
That's your word.
Okay, you got your, oh, wait, here, I'll write it on mine. You want mixed greens,
Mhm.
chicken?
It comes with everything. It comes,
Oh.
when you say mixed green.
No, when we do it, we have to click per, yeah, when you order.
Oh, yeah,
So you want mixed greens, you want chicken,
yeah, I'll take chicken.
toppings?
I'll take the lettuce, tomatoes,
Okay.
feta cheese. That's it.
Feta, no cucumber, no
Mm-mm.
onion, no.
Yeah, onion.
Okay. Okay, Greek dressing?
Yes,
Did you want cheese? I mean, did you want rice?
rice, yes.
Okay. Brown or white?
Brown.
Okay, thank you. I'm needing.
Thank you.
Okay. Let's see.
No, it's this one.
Yeah, so this one is
Where's the Mercer?
the Mercer, that's way up front.
I know, but that's why I'm just going back over stuff she got
Oh,
here.
yeah.
But I got to the one that above it, prevent,
Oh, you did?
the no virus, but I don't see the Mercer. It's not, in the book, it's not, right after that, see? I got here,
Uh-huh.
and I thought the Mercer was gonna be behind it, but it's not. I just wanted to make sure I was.
Yeah, you just trying to make sure. I see what you're saying.
Yeah, see that? I got to see that, that's all the way up. Anything that she had,
Martha is, I think, is the one.
I think this is the one too.
This is the one.
what page is that?
And that is.
180. 1.18.
Yeah. That's it.
Okay, see, it's the way it's up there, because.
Yeah, it even has it underneath there, remember, it says, remember,
Yep, Martha.
some bacteria is resistant. That one. Antibiotics, see it underneath there? Right here.
Yeah, that's the one.
That's it, but now, keep reading.
Yeah, we.
No, it says remember.
Yes, you remember somebody.
Yeah, there it is.
Oh, I see it now, yeah.
Yeah.
I was looking for that.
No.
That's,
Okay.
she already, she wrote it down, but we got it here.
Yeah, I know we had it, but I was just saying, what did she put down? That's.
Yeah, that's what it was. Okay,
Okay, now we're
Ready?
back to
okay,
moving and grooving.
alrighty.
Okay, so we talked sterile and high level disinfection, which is more for SPD purposes.
Mhm,
Anything that comes in contact with mucous membranes on a patient.
mhm.
We disinfect and clean areas that are considered low/intermediate disinfection.
Why?
Because they're not high level, because they're not coming in contact with mucous membrane. They're not using our stuff to
29.
operate on the patient. So
Oh,
it's just a classification.
it's low.
Yes. Yes, like for instance, not like areas like furniture patients use, doorknobs, beds, wheelchairs, those are on a sterilization, those are low.
Those are low.
Yeah, cause it's not
As far as infection or
Yeah.
bacteria, right?
Yeah, as
That's what
far
you
as
mean?
as disinfection,
Okay,
yes,
as far as the infection.
disinfection
Okay,
areas.
thank you.
You're welcome.
As far as the infection.
So, cause there's critical areas, there's semi-critical, and then
So
there's
where does fungus come in?
non-critical. We're just talking about, we're not talking about actual types of, this
Oh.
is just for cleaning purposes.
Okay, all right.
Yep.
All right.
How we can prevent infection. We're talking about how do we prevent
Prevent,
infection. Fungus
okay.
doesn't fall into how do we prevent, because we don't use fungus to prevent anything.
Okay.
Yeah, so critical, semi-critical, and then non-critical is where environmental service technicians fit in. We're in the low to intermediate level disinfection. Because high level disinfection is SPD, where they're sterilizing the equipment that's used on patients.
So
Like,
we're low.
yeah, we're on low
Low
level disinfection.
Disinfection kills, yeah. okay,
Yes.
Okay.
So looking at this picture, can we tell what should be cleaned, disinfected, or sterilized? You want to turn to page 1.29 in your book,
Mhm.
and then we're gonna label those, out of those three, we're gonna put each one into one of the categories.
That don't touch?
No, sterile,
disinfect?
don't touch, disinfect, or clean. So for
Okay.
instance,
Line, do not.
the IV line, that's sterilized, yep, do not touch, so you wanna
Do
put
not
that there,
touch.
yep. And then as we put it, just put a little mark next to all the ones on
So what do
top.
we put, IV pole or IV?
No, that is not, that's. We can.
Oh,
use regular-
line.
Yep,
I got it.
and
Okay.
then for disinfect, what will we, which one of those, are those,
Yep,
Yep.
definitely.
toilet?
And we just clean the top, the other one.
And then, yep, and then we just clean it, that's just a light fixture,
So
we don't
we wipe it.
we just wipe it, yeah, so we just clean it. We don't necessarily have to
Do
disinfect it,
anything.
yeah.
Okay.
Cause that's not a high touch surface. When we think of disinfecting, we think of all the high touch surfaces that a patient or anyone could come in contact with.
Mhm.
I don't wanna go too far, so
Okay.
we're gonna go through the list here.
Okay, go ahead.
The first thing, bed rails and controls, what would we do?
That would be disinfectant.
Disinfect, that sounds,
Mhm.
yep, everybody agree?
Mhm.
What about tray tables?
Disinfect.
Disinfect? What about surgical instruments?
No, we do not touch, because
Correct.
Yeah,
That's sterile.
that's sterile.
Stairwells, what would we think?
Clean.
Yep,
Clean,
It's
yeah.
clean, yep.
Just clean.
Floors in public areas,
Clean.
yep.
Clean floors.
Room inner doorknobs and plate,
Disinfect.
yep.
Walls.
Let's see, nope, the next one, we're just going through down the whole list.
Bathroom.
Bathroom handrails by toilet,
Disinfectant.
yes. Wall mounted lamp,
Clean.
yep.
Hallway
Hallway light fixtures, yep, that's a clean. What about the telephone?
Disinfectant.
Yes. A chair,
Disinfectant.
yep. How about a shared desk?
Disinfectant.
Disinfectant.
Yep. A room sink,
Disinfect.
Disinfected.
unused cotton swabs,
Not touch.
yep. A room light switch,
Clean.
a room light
Oh,
switch,
no, disinfectant.
yeah, cause everybody's touching that, yep.
Disinfectant.
What about a scalpel?
Don't touch.
Not touch.
Yep. Ivy pole grab area,
Disinfect.
Disinfectant.
yep, disinfect. A call box button, that's like the call, that's your call, yep, disinfect, like the call, the patient call.
Oh,
Yeah.
Bedside table handle,
Disinfectant.
Disinfect.
yep. A bathroom light switch.
Disinfectant.
What about scopes?
Not touch.
Yep, we don't touch those. Bathroom sink?
Disinfectant.
Disinfect.
Yep. How about the toilet seat?
Disinfectant.
Disinfect.
Syringe? No, we don't touch that, you're right. Toilet flush handle,
Disinfectant.
toilet bedpan,
Disinfectant.
Disinfect.
yep. Elevator buttons,
Disinfect.
yes,
Disinfect.
we do. How about the elevator door?
Clean.
Yep, we just clean those. Now, why would we disinfect the elevator buttons and just clean the elevator doors?
Because people touch them,
Yeah.
those are highly touched surfaces.
Yep, that's right. And what about the mirror?
We just clean.
Yep, we just clean the mirror. Thank you, yep. So what's the difference between cleaning and disinfecting?
Disinfectant gonna kill the germs and
Yeah,
stuff.
and it's a sit period. It's the stay that is sit and dwell. It's a dwell period.
So cleaning, we'll talk about that, is the removal of materials like dust, soil, blood, and body fluid. Physically removes rather than kills the microorganisms. So, like, we always say we have to clean before we disinfect. Like, for instance, if you go into there's a bunch of food on a tray table, you clean that food off and then you disinfect it because you're removing all of the food on there first, and then you have to go wipe it. Cause if you try to disinfect the area that has stuff on it, you're not really gonna disinfect it because you're cleaning the stuff off that area first. You get it?
No,
No.
say it again.
So you have to clean that area before you disinfect it. So say you have a table, has a bunch of food on it, you're wiping all the food off, you're just cleaning the food off the table, but you're not necessarily disinfecting it.
Yeah.
Because you're removing the food off the table first.
Yeah.
And then you have to go through when the surface is empty to disinfect it, to make sure you get every space
Yeah.
on that surface.
Yeah.
Cause if there's stuff on the surface, you can't really disinfect what's under that, like all the food. And if you're just wiping it up and cleaning up the crumbs or whatever beforehand. And it's always essential prior to disinfection or sterilization. You always have to clean first. And then also, a surface that has not been cleaned effectively cannot be properly disinfected or sterilized. So things to remember is cleaning physically removes the dirt and microorganisms and prepares the surface for disinfecting. And disinfecting kills most of the organisms. So disinfecting is the inactivation of pathogens It usually involves a chemical, heat, or ultraviolet light. Sterilization destroys microbial life, including bacteria, viruses, spores, and fungi, and is not performed by environmental services. So that sterilization process is more SPD for those things. And then the most common disinfectants used are quaternary ammonia compound products, acylated hydrogen peroxide based products, and then also sodium hydrochloride, which is bleach. So we use all three of those, but however, in the main hospital, your go-to is the hydrogen peroxide wipes. And we also use, what do we use bleach for? I forgot.
This, infection rooms.
For which ones?
Contact
Contact
Plus.
Plus. Yes, that is correct. So why is it important to know when you clean and disinfect, you think? Why is it important?
So we stop the plate, spraying the,
We stop the spread,
Yeah, to spread up the.
spread of bacteria or
Yep.
disinfection.
I'm moving it around, yeah.
Yeah. So we're gonna talk about a cleaning process right now. So what we do is, since we know the difference between cleaning and disinfecting, it's time to focus on cleaning techniques. And you will complete these tasks every day to help you kind of prevent the spread of infection. So let me see here. The first thing we want to do is we want to clean counterclockwise or clockwise. Why do we want to clean clockwise or counterclockwise when you go into a room? Why would you want to do that?
I guess you go to the hardest surface first, right?
Yeah, but why would you want to clean, like, say you want to start, if you start cleaning clockwise, you start here, you go here next, you go there next. Why would you want to go that way?
Cause you just moving it over like, I mean, like.
No, because I'm killing the infection.
No, but why would, no, we're not talking, we're talking about the process of what, of
Oh,
cleaning right now.
why you
So
wanna
why
do
would we
it?
want to do it in a certain manner? Like we go from top to
So
bottom.
we don't
counterclockwise.
forget.
So you get everything, right?
Yeah. That's why I do
We
it.
want to, and we also want to go from cleanest to dirtiest in the area. So that's why you want to do high, maybe like high to low, because you want to clean you want to start with the stuff that's the least dirty to the stuff that's the dirtiest. So that's why we clean the bathroom last.
Right.
Do you sure, do they know, people know that they clean the bathroom last, or do they know that you're supposed to go straight in and clean it? Because a lot of people go straight in and clean that bathroom.
Well, they're gonna know how you train them.
Yeah, but even if you told them that and they keep doing it, what do you do after that, though? What happened to the trainee?
You just let your manager know,
Okay.
because everybody gets the same training, they do the same competencies. So all you can do is train them on how the proper way to do it, and it's up to them to follow that procedure. And people that don't follow it just won't be here eventually.
Okay. All right.
And then you wanna go for clean from top to bottom, because that's the cleanest areas to the bottom is the most soil. And you wanna wipe in one direction. Why would we wanna wipe in one direction, you think?
Just clean that together.
Yeah, like why? You think if you just, like, if you wipe in one direction,
You're not wiping it away from.
Because if you're
Yeah.
going back and forth, then you're not.
You could be
Yeah,
spreading,
yeah,
right?
Yeah, yeah, so I just wanna wipe it one
Absolutely.
way.
So behaviors.
Can you just go back for 1 second, please, Sean?
Sure will.
So these 4 things, I would make special note of them,
Yes.
okay?
Okay.
It would be very likely that you'd see this on a test.
Yeah.
Very likely you'll see this information on a test. Clockwise or counterclockwise, clean to dirty, top to bottom, and in one direction. Now, we're also gonna come back to these probably about 5 times in the next couple of days. So you'll hear them repeated over and over and over again. Good advice that would be, if you hear something repeated 2, 3, 4 times within the course of this training, you're probably gonna see it on the test. But make a note for this, because this is important.
And when we say one direction, we're not talking about the group.
No.
And
My
that's it.
Yeah.
daughter is on her way to Toronto right now to see
Oh,
Harry
wow.
Styles. To see Harry
Lucky
Oh,
Styles.
really?
Lucky her, she
Harry
got
Styles.
tickets. She got tickets.
She got tickets to Harry Styles, yeah, she's very excited. Obsessed with that kid.
So we'll go into more detail for cleaning and disinfecting during other sessions, but
Okay.
now we want to just touch on the basics. And we'll review another key behavior for preventing and controlling infections, wearing proper PPE. But first, we're gonna It's for why we use PPE. But first, let's fill in your questions before we do that. On page, was it 1.30? Yep. So it's the cleaning versus disinfecting. Cleaning is, what is cleaning? We discussed
Removal of,
removal, yep. Removal of the materials like dust, soil, blood, and bodily fluid.
and physical removal.
Yep, it physically removes rather than kills organisms. Oh, you already got yours in there, Mo? Perfect, good, you're doing
It
it.
says always essential.
Yep, it's always essential. Prior to disinfection or sterilization.
Then a surface.
Yep, a surface that has been cleaned effectively cannot be properly disinfected or sterilized.
Then they got an inactivation.
Yep, disinfecting is the inactivation of pathogens. Usually involves chemicals, heat, or ultraviolet light. Yep. Sterilization destroys microbial life, including bacteria and viruses. Yep. And then we got those all in there.
Okay.
Got it. Make sure you got all your answers in there.
Mhm.
And did you fill in on the other page, the next page?
I didn't fill it in.
Okay,
I
we
just
want
said
to, just because we want to make sure that you get all the answers just in case.
one.
And then I think we get, so why do we clean clockwise and counterclockwise? We'll review that again.
You just put it down, I just seen it.
Or why do we do it?
Clockwise or counterclockwise, why do we do that?
Yeah, why do we do it?
Why do we start at one side and go all the way around?
We do not miss the.
So we don't
So
miss
those are,
anything.
yep, so
Yeah,
nothing
we
gets
get
skipped,
everything.
yep,
So nothing gets skipped.
yep.
Right,
And then why do we clean from top to bottom? Think of it, what's the first step we use? Why do we hide dust first?
Because it's the lowest dust. It's
Yeah,
probably the lowest,
and then if you start at the bottom and you hide dust last, where's all that dust gonna fall?
back down to the bottom.
Yep,
So, yeah.
start at the top and work your way down.
yep,
And if you really think about it, our steps are, we obviously get trash and stuff out of there first, but it's high dust, vertical surfaces, so wiping of surfaces which are down lower, okay? And then, bathroom and then the floor is last, because the floor is the lowest thing. So our process points you to top to bottom.
and why do we start with cleanest and move to the dirtiest?
Because the cleanest would be less.
Reduces the likelihood of spreading, yep,
Yeah.
spreading contaminants. Infection prevention, but it's an infection and prevention based practice. And it also increases efficiency and safety, doing it from cleanest to dirtiest. And then why do we wipe in only one direction again?
So not spray.
So, yeah, so we, no.
Yep, so to not recontaminate the surface, yep,
Not
that's
to-
right.
Not to recontaminate.
Yep. And then also we make sure the clean solution is applied to the entire surface when we go in one direction. Perfect. So do you guys remember when we learned about the chain of infection? We said that healthcare environmental services technicians can break the chain. You remember that, how we watched that video? Standard precautions help break the chain, and they're the reason why we do what we do to control infections. Well, some of the things that you have to know the pathogen, you have to follow the cleaning and disinfecting steps properly. You have to wear PPE, and also the most important thing is using hand hygiene. So you can follow standard precautions by. This is on page 1.32,
Mhm.
performing hand hygiene.
And this is standard precautions,
Yep.
remember, standard versus airborne droplet contact. Standard is what we do every single day.
Okay. That's what they mean by standard?
Yeah,
Yeah.
every day.
Every day, what you do every single day when you come to work, those are the
Why didn't
standard
this one put
precautions.
daily?
What's that?
Because it's a standard.
It's a standard. It's a
Okay.
standard thing that everyone does every day or should be doing.
So standard precautions are based in two important principles. All blood, body fluid, secretions, excretions that may contain pathogens that can spread. And then also they apply to all patients regardless of suspected or confirmed infections. So we always use standard precautions no matter what. Even if the patient maybe say they don't necessarily have a disease that can spread, we always want to use those standard precautions. So this is why we learned like to roll in, like we don't necessarily take the linens off the beds, but we roll linens, for example, in a ball when they take them off the bed, so we're not spreading anything that could be in those sheets. So you want to roll them instead of just like picking them up and moving them all around. You want to treat everything like it could be, you know, contaminated.
Contaminated.
Yep. So some also standard precautions, we are using PPE. And then handling items such as linen and waste as if they are infectious or contaminated.
Contaminated.
Yep, or contaminated. Yep, and that's the question, that's you write it on page 1.32.
Mhm.
Everybody got that? I'll give you a second to write that in. We're on 1.32 and your guide. Everybody got it?
Mhm.
Okay. Transmission-based precautions we're gonna talk about. So what, does everybody know what we say, what we mean when we say transmission-based precautions?
Transmission.
That's when standard precautions aren't enough, we go to transmission-based precautions. Transmission-based precautions are like your isolations, different types of isolations.
Oh, there are different types.
So what are some types of isolations that we have?
Airborne,
Airborne, what else?
droplets,
Droplet,
contact.
contact. Yep, those are the basic three, wherever hospital you go to, they'll have airborne, contact, droplet. Here at the hospital, we're a little different, because like we have isolations, like on the 5th floor, we have protected environment signs. That's specific to our hospital, but you might not find that everywhere else.
Oh,
We also have like contact plus, we put those on there to
and now the
notify.
COVID, does that count?
No, COVID, yeah.
Cause now we're using the COVID signs.
Yep, but it's still, we have the COVID signs, but it's still, if the patient's in there, still, you know, airborne if they're in there. So we just have those specific ones we wanna know for the exam, you wanna know contact, airborne, and droplet transmission-based precautions.
Those are
The
main
three
ones.
main ones you wanna know that are gonna come up on the exam.
Okay.
And like Felicia said, those are the same anywhere you go. You go to a hospital in Tennessee, they have those are standard across the country. CDC guidelines, those are standard precautions. They're not standard, they're the same as you would get anywhere else, transmission-based precautions. So you're not gonna go over to Callida and they're gonna say, well, I know you guys called it airborne, but we call it, you know, we call it Nature Valley precaution. It's
Okay.
gonna be
All right.
airborne precaution, you know, it's the
Okay.
same thing.
So we have contact, airborne again, and droplet.
Mhm.
So contact precautions. It's spread through touching, wearing gloves, wear gloves and gowns, and you also perform hand hygiene before and after.
Mhm.
So what is a contact precaution, you think? From that description there, what is a contact precaution?
We're gonna say C. diff.
Yeah, well, no, but contact precautions, what is
Oh,
a contact? Is it?
Oh, meaning the
Mhm.
actual contact.
Yeah, that means if you come into a contact with that patient, you wanna make sure you follow those proper guidelines for that.
And wear a gown, it says, wear.
Yep, you wanna wear gown and gloves and perform hand hygiene before and after. And it's just as hand hygiene because it could be either alcohol-based product or soap and water.
You really think of the first word in each of these
Uh-huh.
is how it is spread. So contact meaning you have to have contact, direct contact with the patient or with the bacteria or.
Before and after?
pathogen.
It says wash hands before.
Yep, you always wanna wash hands before you enter a patient room and after. Or you'll perform hand hygiene, not necessarily wash, unless it's a C. diff room. You
Okay.
always wanna wash your hands with soap and water at C. diff rooms.
Gotcha.
You may also be asked to clean droplet precautions. And then what are droplet precautions? What's a droplet?
Well, sneeze
Yep, is it a droplet? Yep, that could be.
or cough.
Yep. Droplet precautions are intended to prevent the spread of pathogens through like cough, sneezes, like you said, and respiratory secretions, pretty much.
So it's to block it, it's to
Y-
block
yeah.
it from coming out?
Mm-hmm. So we use our standard precautions, and then we also want to add a mask to cover your nose, cover your mouth, so none of the secretions can get in there. So what are some examples of pathogens that require a droplet, you think? Like, what is something that could be spread through a droplet? Yeah, like what can be spread though? Like we
Like
would
a
say
cold.
like a cold or flu maybe, yep. Whooping cough is another one, meningitis, just as a couple of examples.
You said meningitis?
Mm-hmm.
Hmm.
Yeah, it has it down to.
Why? Oh, okay.
Cause it's spread through droplet.
Oh, kissing. Right?
Drop, not necessarily just droplet, like if
Yeah, let's say
anything that
someone
comes out.
coughs, they cough and they don't
You
cover
can
their
get
mouth.
meningitis from someone coughing?
Well, if the droplet gets into an open portal
Oh.
of you, not just because they coughed, there have to
Oh.
be those 6 elements in order
Okay.
for anyone to get it.
Okay,
So
gotcha.
just because they
It's gotta
cough
be an
doesn't
open-
mean you get it.
Okay, it's an
You
open
would have to
wound.
then have some portal of entry and
Open
be a
wound.
susceptible host.
Okay, gotcha.
Yep, and you must be masked all the time if you're in the area with droplet isolation. But we're masked all the time in a patient hospital now anyway, but if we weren't anymore, you still would have to wear that mask to help protect yourself. Yep,
Mhm. Okay.
and the next one is an airborne isolation. So what are airborne isolations? The procedure we use is to prevent the spread of pathogens that remain infectious over a long distance that's suspended in the air.
Okay, spreads in the air.
Yep. Some examples of the pathogens that require airborne isolation. Anybody?
Sneeze.
We're on page 1.36. Yep.
Sneeze,
Some examples of airborne isolations.
oh, isolation.
Yeah, so what's an example of an airborne isolation? Tuberculosis, is that?
I know,
TB?
but do they let you come in the hospital with tuberculosis?
Yeah, we
Does it-
have to treat everybody. We can't
Oh.
discriminate if they have something.
Even if they got the monkeypox, are they gonna let them come in?
I think,
Well, we're a little different when we treat cancer, but they will have to. If you can't just say you can't be treated because you have a disease.
Hmm. I get
Like
it.
but measles, chickenpox, those are the examples
Oh,
of
yeah, yeah,
airborne
yeah, yeah, yeah.
isolation.
Okay.
TB,
Yep.
TB, yeah,
Mhm.
tuberculosis.
Yep, tuberculosis.
that's why we get you fit tested.
Yes.
These are the ones that require the N95 or the PAPR. But the N95, the duckbill mask or the N95 mask.
Patients are required to stay in a negative pressure room with the door closed. That's why when you see those airborne isolations, we always keep the door closed.
And do we come with a fibrillator or whatever so they can breathe and we can breathe when we go in?
What, no, what do you mean, does what come with a defibrillator?
The person, when they get in the room, you know how they put the HEPA filter in
The
there?
HEPA filter? No, you said no, does what have a?
The person, will they have it in the room?
No, they'll be in a negative pressure room.
Oh, negative
Yes,
pressure.
you know
That's
how,
what I'm
yes,
saying.
oh, a negative
Okay,
pressure
yeah,
room,
okay.
yes. Or they'll have a HEPA filter brought in.
Okay,
Yeah.
that's what I'm trying
Yes.
to get to.
Got
Okay,
it,
yeah,
got
yeah,
it.
yeah. Okay.
Because the negative pressure rooms are all HEPA filtered in the seal.
Mhm.
We don't have to bring in one
Oh.
of, we don't have to
Built-in
bring
HEPA
in
filter.
one of the portable units because they're
Yeah,
already built with.
But I
HEPA
see them
filtering.
do it, but that's
They
an
might do it
extra
sometimes just as
precaution?
extra, but the rooms
Okay.
themselves, as long as the doors remain closed, they automatically ventilate through HEPA. And actually the exhaust goes right out of the building. It doesn't come back in, it doesn't get recirculated. The air gets
Oh, that's good to
exhausted
know.
right out of the building.
I never knew how it came, did it come back?
Yep, no, they don't recirculate, and it's 100% fresh air coming into those rooms.
Okay, all right.
So the next thing we're gonna do, we're gonna have a little fun. We're gonna work with little teams here. Mo and Wanda, if you can work together, and Sharita Kapil and Rebecca, if you can, you're gonna work on your page 1.37.
Okay.
You're gonna decide if you think the mode of transmission is contact, droplet, or airborne. So we're gonna give you guys 5 minutes to work on this, go through each scenario. And then
You wanna see what type of precaution will we use on the bedside commode?
yes, but see, for instance, yep, I want you guys to get in teams first and review
Okay,
it.
come on over.
And then say if it's
Middle?
contact,
I'll
droplet,
get in the middle.
airborne.
Okay.
Contact.
Put it in right, if it's contact,
You gonna write what
Yeah.
precaution they are,
yep, type
contact?
of precaution, and then PPE,
Okay,
add the PPM for, PPE for me.
okay, and this will be contact plus. Yeah.
Personnel.
Yeah, because it says CDF. Oh, yeah.
And then you only wanna use the 3, contact, droplet, or airborne. Those are your 3 options. And you only have 3 options. I heard you say contact, contact plus is not an option. You either have to use contact, droplet, or airborne. So we're going
We
with the
can't say
standards,
plus,
No.
just contact.
because that's not gonna be an exam plus, because that's, yes.
Okay, contact. I got
We
you.
say contact plus here, so you know to use
Okay.
bleach.
Oh,
Okay.
okay.
Because if you go to other hospitals, they might not have contact plus. They're gonna have the standards, so they're gonna have contact, droplet, or airborne. So you wanna list,
Because
We have, potential to expose the bloodborne pathogens.
can also use,
Because, yeah, when it said leaking, I picked up.
It's a contact.
Yeah.
Yeah, it's contact. Yeah, it can't be airborne.
also put your PPE, what you should use for each one.
Oh, which,
Yeah,
okay.
what PPE also put on there.
Our gloves are, that,
Whatever PPE, personal protective equipment, you should list on there what type of personal protective equipment you have to use for each isolation.
Everything.
okay. Well, CDF running gloves and gowns. And for this cold, we can just use gloves. Make sure of that. And then the technician does not see the installation running on the door, but enters the patient. Without it. Oh, they got influenza, they got a cold, they got
Well, this is
flu.
pretty. South.
So I'm thinking,
No, that's,
that they have.
he should have had a mask on.
So that would be airborne.
Yeah, because it's free, yeah.
Parked in the radiation lot, license plate change. 4642, please move your vehicle. Once again, the owners of the Bridge parking radiation lot.
And in this one, you have to wear a mask.
12, please move your Jeep as well.
I have to but only wear gloves because it's only thing it is blood. They didn't say anything about being exposed to anything else.
Cause it's dripping, but
But it says cuts in your finger.
that wouldn't be,
What did you thinking of
no,
that?
no, we're gloves, you're right. I thought they were
No.
saying leaking. Or something.
Oh,
I-
you looked at,
I
yeah,
actually
yeah.
saw leaking and thought-
Yeah.
Yeah.
No. The cold stop leaking.
Yeah.
No,
They said
stuff
leaking,
is
I'm
on the
thinking
floor.
it's- yeah.
Okay, now this patient has infected with measles. God darn. Okay, we'll contact measles. It's gotta be. And we will use gloves and gowns and masks.
So proper PPE.
We're using gowns and masks. a little scary, because what if you never had it?
You definitely can't, yeah. Touch nothing, touch.
Yeah, that's what I'm thinking. Then it says the person with tuberculosis, we wear no 3 again.
Yeah. Definitely.
And we don't gotta use gargles, right? Only gargles is in that, is it COVID room again?
Face shield is, or goggles is typically only when splashing or splattering is likely. So for us, we're not typically at bedside doing things with patient care directly that's gonna expose us to splash or splatter. The only time we're typically highly likely or potentially likely to get splash or splatter is usually cleaning the bathroom. So if you're cleaning the bathroom and you feel like you're potentially could be splashed or splattered, wear safety glasses. I mean, we provide them, everyone should or could have, should have a set available to them.
Mhm.
And if you feel more comfortable doing it and feel like you could get splashed in the eye or a mucous membrane, then wear the goggles. You also wear glasses, which probably prevents a lot of it.
Or shield, can we wear that shield?
Face shield, sure.
Okay, we're all set?
Yeah.
Okay, wait, first let's go over it. So the first one says, a bedside commode of a patient with C. diff was not thoroughly cleaned after they were discharged, and the next patient that used it contracted C. diff infection. What is the mode of transmission? So was that, what did you guys say that was? Contact drop, contact? Yes, all medical equipment that is used with patients on contact isolation should be effectively cleaned and disinfected between patients to prevent the spread. The next one, a patient's IV becomes disconnected and blood is leaking onto the bed and surroundings.
Contact.
Yep, that is contact. The healthcare workers should wear gloves in accordance with standard precautions for anticipated contact with the blood and body fluids to prevent exposure. Then also hand hygiene should be performed immediately after removing the gloves as well. The technician does not see the isolation sign on the door and enters the patient room to clean it without PPE. The patient had influenza and the technician becomes infected. Is that, yep, droplet, that is correct.
It's drop,
Yeah,
airborne,
yeah,
right?
no, flu. Remember we discussed that? The flu was a
I
droplet?
didn't even see that. I forgot all about
Yeah.
droplets.
Yep. So,
Droplets.
yep, if you check that,
Golly.
and then on page 1.35, the flu was one of the examples of droplet.
Yeah, you're right.
And a surgical mask, it should be worn in those types of rooms. A patient infected with measles enters the ED waiting room without wearing a mask, exposing all susceptible people in there to measles virus. What is measles considered? Airborne, yes, that is correct. Patients with measles should be given a mask to wear until they are placed into an airborne isolation room. A patient with active tuberculosis, which we call TB, was in an isolation room, but the environmental service technician did not follow the proper precautions by wearing a respirator when cleaning the patient's room. The technician was potentially exposed to tuberculosis. What type of isolation is TB?
Is that airborne?
Yes, it's transmitted by airborne route, and a respirator is required before entering the room. And then also you have to be fit tested to wear a respirator. You can't just say, oh, I want to wear a smaller, that's why we do the fit test yearly to make sure that you have the right size and protect it correctly.
So you write that test behind it or no?
No, I was just sharing that information that you have to be fit tested to wear a respirator. So the type of precautions dictates what choices of PPE we use. Do you know what you need in every situation that you encounter? You want to make sure, that's why we always ask those questions. Do you have the right tools? Do you know do you have the right equipment? Do you need safe? Yep, because you want to make sure you know. So now we're going to talk about why do we use PPE? We want to make sure we use it to keep our hands and clothes clean when touching items and surfaces that might be contaminated. We're going to also to protect our hands and clothes from chemicals. We want to use it as a barrier to break the chain of infection. And as proper precaution to prevent technicians' exposure to blood and body fluids during the tasks that take place, that place us at risk. And also, we want to protect others from pathogens that could be carried through our clothes. So what is important to remember when donning PPE? Do we all know what the word donning means?
No.
So, yeah, instead of saying put on your PPE, it's called donning.
Yeah.
And then when you take off your PPE, the technical word is doffing. Doffing, DOFFING. So it's donning and doffing. So what is important to remember when donning PPE? The first thing, you want to perform hand hygiene. That can either be putting on, you want to use an alcohol-based product or washing with soap and water. You want to put on your gown. The gown should fully cover your torso from your neck to your knees, your arms to the end of your wrist, and then you want to wrap it around in the back. Also, then you want to put on your mask or respirator. See, this is when before we were wearing masks. Now we're wearing masks all the time. You'll already have it on.
Yeah.
But say in the event you're in an airborne isolation, you will have to take off your regular mask and then you have to don a respirator. You want to secure the ties and elastic behind the middle of your head and the neck, and then it fit flexible bands, to you want to make sure the flexible band right there at the nose, you just want to squeeze it a little bit so it holds there nicely. And you want to make sure it fits snug to your face, so nothing could, get in there. And then you want to make sure it goes right below the chin.
Hey, so for all three of them, we gotta wash our hands before and after?
Yeah, whenever you're doing something, because
Like
Before you put on
contact
your-
goggles and all
yeah,
that?
you always want to do that before you go into each room, you're supposed to perform a hand hygiene.
Okay.
And that doesn't mean necessarily soap and water, it can mean just Purell.
Okay.
Mhm.
That's
And you
considered
said
hand hygiene.
it's not supposed to go no farther than here.
Right, right under your chin, it sits there.
It sits right here?
Yeah, like right under your chin, yep.
I didn't know if I had it on right or wrong.
Oh,
I
you-
never know, but, cause when they ask us that question, when we do the fit test, they ask you, do you smell anything coming inside?
Yeah,
So when you say no,
that means it's on right. Because if it
Okay.
wasn't on right, you would be able to taste or smell all the liquid that they
Yeah.
spray in there.
Okay,
Yep, so if you don't smell it or you don't taste it, that means you're good.
okay.
Yep. Then you want to put on your goggles or face shield
Mhm.
and then adjust it to fit. You want to hold, the lastly, you put on your gloves. You want to hold the gloves at the wrist opening using the other hand to pull them on. Be sure the fingers are fully extended into the gloves and fingers, and that the fit shouldn't be overly tight. And then you want to extend the glove opening to cover the wrist cuff of the isolation gown. So you want to cover like the cuff at the end of the gown.
With the glove?
Yes, I.
So did you get why we use PPE? Did you want to put that in your notes?
I said to keep our hands in.
Clothes clean.
Clean.
Yeah. Yep, everybody got
And
that
stop
in
the
your notes?
spread. It
That's
stops-
1.38.
And it stops the spread, right? Also stop the spread, or did I just write that just to be right?
Well, it do, yeah, it does, yeah, that's true, yeah.
Okay.
But it protects your hands and your clothes from chemicals.
Yes.
Yep.
From chemicals.
Yep, it's used as a barrier to break the chain of infection.
Okay.
Okay. Now we're gonna look at doffing your PPE or taking it off.
Okay, yeah, that's what I.
So doffing is what we do. We wanna make sure we remove the PPE at the doorway before leaving the patient's room. We never wanna come
Inside their door? or
right there at the
outside?
door, at the door. You never wanna leave the patient room before taking off your PPE. You take it off right at the door.
Yeah.
Yep,
Like, what, I'm confused. What do you mean, right at the door? Cause I take mine off inside the room.
where you take it at the door?
At the door,
Yeah,
but
at the door.
inside the room.
You right in the doorway, right in the doorway.
A lot of other people do, because whenever I do a room like that, the garbage, they be so full with the yellow gowns, I always make sure that they're double, because I have to come like 2 or 3 times to change the garbage, because they so full with the gowns from nurses, people going in.
You don't wanna leave, because you
Yeah.
can't leave out without, you're not supposed to leave out without taking off. The
Yeah.
only thing you're supposed to have on when you're leave in a isolation room, if it's a airborne, is your respirator, because you don't take that off in the room.
Okay.
Because you don't wanna necessarily contaminate.
Backtrack,
Yes.
yeah. Okay.
Yes, right, it's the backtrack.
So the first, what do you think is the first thing we remove? What's the thing you think is most contaminated if you have all your
Them
PPE
gloves?
on?
That's
Yep.
obviously. them
You wanna
gloves, that's
remove
just
those
tough.
gloves.
Yeah.
You wanna use your thumb, and then pull the glove down by grasping the outside of the glove and peel it away and turn it inside out.
Yeah.
And we're gonna practice this, so we're gonna get PPE for everybody, and we're gonna
Okay.
practice this later.
Okay.
And then also after you remove your gloves, you wanna remove your goggles or face shield. You wanna remember that the outside of the goggle is considered contaminated, so you wanna remove it by the earpiece or the head, yep, or the band. And then when you remove the gown, you wanna pull it away from you. And then like
Yeah.
fold it up, so you won't contaminate yourself as well.
Pop the strings and then come down.
Yeah.
And then the last thing, if you're removing is your respirator. Remember, the front is considered contaminated. So you wanna move it, bring it on the back of the sides, yep.
What, take it down off your head like
Yep,
this?
and move it away from you.
Away from-
You always
yeah.
use it from
Don't-
away from you.
Ah.
Because this part is contaminated, so you don't wanna necessarily infect yourself. And you wanna make sure you do not touch it, that front. You wanna only grasp it by the ties.
Ties on,
Yeah.
ties on.
And then you discard it right after you use it. And then what's the last thing you wanna do? After you take all of your PPE off?
Wash your hands.
Yep, hand hygiene.
Hand hygiene.
That is correct. Okay. Let me get to, I don't think I ordered our gowns. I forgot to order gowns. We're gonna.
We can do it after lunch.
Yeah, we'll do it after lunch. I thought about that. I didn't order the gowns for that. Cause then we're gonna practice. We're gonna give you guys some gowns, some gloves, your face mask. And then you're gonna get up here an example. Yes. Oh my God. Oh, how about that for timing? Oh, yeah, it's 12. I didn't realize 12 o'clock.
Oh, it's
Lunchtime.
going
And they
quick.
number them, so maybe they're.
Good.
gotta
Well,
read
how
the
about that for
numbers.
timing?
Perfect.
Yeah.
All right, and the signs are actually inside the thing, so I can, inside that book, because that's the next thing we do after.
Perfect.
All right.
Oh, yeah.
Okay, so we're gonna take a break right here
Okay.
and enjoy our lunch.
All
Half an
right.
hour.
Half hour, all right.
Thank you.
Back at it at 12:30.
And then I'll fill these out. Oh, yeah?
Do you want to
My
stop
stuff
recording?
upstairs in there.
And then start
Oh, yeah,
the
I will.
session?
Then
That should go take my blood pressure while I'm up.
Yes, we're gonna stop recording in a moment. And
Yeah,
then
it
we'll
means I
start
gotta go back
recording
up to my
the second
floor.
session this afternoon.
Get my blood pressure check, monitor. Well, let me see if my doctor called back, not yet. Not yet.